Da-da. Well, if we could take our seats, we're going to get started. Give folks a chance to find their way. Wow, that worked. Everything got quiet. Good morning, and welcome to the 2024 Walsh University Mental Health Symposium. I'm Dr. Mike Dunphy. I'm the Vice President for Academic Affairs here at Walsh, and just delighted you're all here to be part of this event. This is terrific. So Walsh, we're, as a Catholic university, we're very much dedicated to serving the common good. I think that's why we're all here today, to help ourselves become better at doing that for the people that we serve, to improve our community and to help everyone around us find a better place to be in terms of mental health. So I think that's absolutely terrific that you're here. I always tell a little story about chemistry because I'm a biochemist by trade. So who's ever heard of the second law of thermodynamics? I know probably every day you think about that, right? So I want to tell you this because it applies to everything we all do every day. We all serve the common good because it takes so much work, so much time, so much energy and effort. So the fact is, the second law, if you don't do it in differential equations, you do it in English, sounds like this. Left unattended, all things will spontaneously proceed to chaos. So if you do nothing, you get chaos. What it takes to create purpose and meaning and pathways is effort, energy, time, talent, what we all put into this every single day. And speaking of that, we have a very special guest here today with us. Linda Byers and her grandson Brett are here visiting. Not only has Linda helped us with this event by sponsoring the breakfast, but Linda for many, many years has been a benefactor for Walsh University. She has a great heart. She's a person who's passionate about nursing in particular and mental health as well, especially for families who are serving us in the military, firefighters, first responders, and folks who are in that bucket, as well as those in Gold Star families. Linda's name, Gary and Linda Byers, on our nursing school. It's just terrific to have her here today joining us because this is what she's all about, it's what we're all about. And I hope today as you go through this day of learning, you find some things that help you become better at serving the common good. And if we can do that every day, we're doing something really well. Walsh University welcomes you, and I want to welcome my colleagues, Dr. Michelle Tilstra, who's the director of our occupational therapy program, and Dr. Tiffany Peets, one of our amazing faculty members in counseling and human development. So ladies, the floor is yours. Thank you, folks. Appreciate it.
Thank you, Dr. Dunphy. So good morning. We do welcome you to the Mental Health Symposium. This is primarily sponsored also by our COPE grant. So many of you have heard about the COPE grant, but it's the Counselors and Occupational Therapists Professionally Engaged in the Community. So you can see why we call it COPE. So we have many students here who have been part of the COPE grant. A lot of our speakers today were part of that process, and that's been a joint effort between occupational therapy and our counseling programs, training students on how to work with high needs populations in underserved communities specifically. So we also welcome all of our members of different agencies here, so make sure during our breaks that you stop in and visit and chat with them. So we thank you all for coming and setting up tables here today. I am Dr. Tiffany Peets.
Good morning, everyone. I'm Dr. Tiffany Peets from the Counseling and Human Development Program. I'm also the Field Experience Coordinator, so it's nice to see some supervisors, lots of alumni, and current students. I also welcome everyone, OT students, and this is a great day for interprofessional collaboration, so encouraging and inviting everyone to talk, network, talk about your career, your passions, and we'll all come together talking about youth and young adult mental health.
We would like to invite you to please stand. We open events here at Walsh with the Pledge of Allegiance. And then remain standing for prayer. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Father Trudell.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Almighty God, creator of every human person, you who give health and life, you who call us to beatitude, grant that each and every one of us may be caregivers and fosterers of that beatitude, that we might lead those who are in our care to your gracious and loving goodwill. We ask, Lord, that you bless our day, bless our conversations, help us to be those instruments in your hand of health and fulfillment. We ask all these things through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
So we are going to start the day with one of our great speakers. I'd like to introduce our first speaker, Mr. Quebec Gibbons. Quebec Gibbons is a licensed professional clinical counselor. He has his supervisor designation for the state of Ohio. He has his master's degree from clinical mental health and school counseling from Walsh University, so this is our good Walsh alum. Quebec focuses on working on a wide variety of clientele, including, but not limited to, adults, marriage and family, adolescents, children, foster care, trauma, mood and adjustment issues. So I welcome Quebec Gibbons.
Good morning, everybody. You would think that as a person that talks for a living that I'd be super comfortable doing this, and I'm so not very comfortable doing this. But it's great to see everybody here. It's great to see kind of the passion behind mental health. I know that mental health the past decade or so has become very much a hot topic, and people have started to pay attention to it more. So before I get into kind of my spin on things, let me at least introduce myself properly and give you guys kind of an understanding about who I am. So yes, Quebec Gibbons is my name. Everybody calls me Q. I graduated from Walsh twice. I did my undergrad here, and then I did my master's here. I was a part of the soccer team here. My middle brother was also an alumnus here, so I feel like I've kind of grown up on the campus of Walsh. And it's been a beautiful process. So to be here, addressing you guys, speaking to you on a place that has meant so much to myself and my family is very much a blessing, right? I work at a company called The Gentle Shepherd. The Gentle Shepherd is about maybe 5 to 10 minutes down the road. We are a Christian-based organization. What's really cool about that is we have the opportunity, if the clients are willing, to engage them in spiritual dialogue and spiritual conversation. Now, it is not a requirement that people are Christian to come to our organization, but it opens up that door to have some very spiritually driven conversations. The first thing that I tell people when they come into my office is I'm a master of absolutely nothing. I just know a little bit of a little bit, right? So as Dr. Pete said, I work with a lot of different populations. I do a little bit of everything. So it's marriage, it's divorce, it's teenagers, it's substance abuse issues, it's men's related issues. Basically, anything that has to do with mental health that we can serve, that's not too intensive, we try to serve. It has allowed me to keep my pen, as I would say, very sharp because I'm having a different conversation every hour, which is really cool. When I came through Walsh's program, there was a time and a space where I wanted to be a school counselor. Being a soccer player, I was a soccer coach in the community, so I kind of thought that being a school counselor and a soccer coach was a good move. Back in 2017, 2018, for all of you that were local, that was the unfortunate time that Perry had a run of suicides and the CDC came in and ComQuest came in, and the community and township of Perry went through a very difficult time. For all the wrong reasons, I was able to get a lot of experience working there and see it from both the school counseling aspect and the mental health side of things. At the same time, I was doing my internship at Pathway Caring for Children. That is foster care, abuse, neglect, and adoption. So I was doing dual internship there for a season of time. I think Dr. Pete's kept me alive a lot of times because I was back and forth between a lot of different things. And then after that, I have served at the Gentle Shepherd for 6 years. I recently got my supervision designation, which is kind of scary and kind of cool all at the same time. So now I am also mentoring newer professionals. So what I'm going to try to do today is I want to kind of give you guys the background from a professional lens on what the journey is for me as a mental health professional, but I also want to give you the background on what I see from like an adolescent, a young adult, and a teenage perspective. So what does it mean to be an authentic therapist or an authentic client? I'm not going to read everything because I get very irritated when people just read what they wrote. It's a lifelong pursuit, right? I'm only 6 years in. I don't have it all figured out. But the longer I've stayed in this field, the more I've become competent, the more I've become authentic in who I am. And one of the biggest things that I think adolescents and people in early adulthood, when they come to therapy, they're unsure of what they're going to find, right? We have all different types of role models. We have all different types of examples of what mental health is, right? So the first thing I do is I try to beat people to the punch, and I tell them, you're not going to lay down on my couch. That's not what we do here, right? Because that's what everybody thinks. You're going to come in, you're going to lay down, you're going to, I'm going to have my pen and pad and paper out. That's not what we do, right? So the more comfortable I am, the more comfortable the teenager, the parents, the young adult is about destigmatizing what mental health can be and what we can achieve in this moment, right? So willingly and intentionally and humbly giving your 10,000 hours. I think everybody has heard that before. In order to be a master of something, you have to give 10,000 hours, right? It takes a long time for us to become competent and comfortable in any walk of life. So all of you have your own respective careers. You have your own respective walk of life. Me, I'm also a new parent. I got 2 boys at home. I'm not the perfect father yet, right? I have by no means given my 10,000 hours to being a perfect father or a perfect husband, which is the same thing as a clinician. I am just upon the journey of becoming something better, which is something that I try to emphasize again to all of my younger clients when they enter the office. Hey, this is going to take time, and this is going to be hard work. One of the newest things, and I call it a Qism, because as you sit in the seat for longer amounts of time, you start coming up with your own ways of explaining things to people. I'm a very common person. I speak in very common language. I don't like to talk over people's heads because I don't think people gain anything from that. There's only probably about 1% of people that want to hear all the minutia and the inner details about things. I just try to keep it very simple. So one of the things I've told a lot of people this year, and I'm a sports guy, keep in mind, that in the year of 2024, one of the most influential people in the NBA was Kobe Bryant, right? And Kobe Bryant, his biggest thing was the Mamba mentality. And when you ask people what the Mamba mentality was about, if you look at it at the foundation of things, it was about suffering. And what Kobe said is, I'm going to suffer more than you in the game of basketball. It doesn't matter what it takes. It doesn't matter how long it takes. All I know is I'm going to suffer more than you to win. So when I talk to my clients about the therapy process, especially my teens, especially my young adults, this is a process of suffering. And I try not to hide it from them. This is a process of hard work. But when you're motivated, we don't look at it as suffering. We look at it as just part of the process. So it is my job to help them buy in to what work we're going to do, but also not put too many expectations on them as to how quick we're going to achieve that work, right? Because we have to suffer to be great. Even me, again, am I anxious? Yeah, I'm suffering up here. But I'm suffering to try to give you guys some good information and good knowledge and be as authentic and real as possible. And that's, again, part of the process of, again, as a client and as a therapist, becoming your authentic self. Imposter syndrome, right? One of the most common terms that we hear nowadays. I think everybody feels it in their own right. Father, I'm sure you've felt that at some point in time with all the expectations you have on your shoulders, what do I think is going to happen when a client comes into my office? They're going to protect themselves. They're going to show all their defensive mechanisms, especially teens. Keep in mind, for a lot of people that may or may not have had therapy before, most often or not, the clients don't want to be in my office, if I'm being honest, right? I ask them, do you want to be here? Do you not want to be here? 9 times out of 10, no, I don't want to be here. They look at mom and dad, and they say, Mom and Dad, tell this guy what you want to know, because I'm here because you made me come here. Right? Or mom and dad have gone through a divorce situation, there's a guardian ad litem involved, and now we're dealing with the child bouncing back and forth between the house. Mom and dad are trying to be preventative and make sure that the kids are growing in their cognitive and emotional development, so they bring them into therapy. The one thing that I think our country and our world struggles with is vulnerability. So you're asking somebody to sit there that's 14, 15, 16, 17, 18, open up to somebody that they've never met in their lives before, tell them their whole lives that they don't really know because they're trying to figure it out, and away we go. No, they're going to have some imposter syndrome just along with sometimes us as clinicians, right? I will never lie to you guys. We as clinicians, we know a lot, but we don't know everything. And we're trying to be the best that we can be. So helping level set with the client is extremely important. And again, I think if you guys are looking to bring kids, if you have teenagers, high schoolers, you have to level set them as they come into the therapeutic space and what the expectation is, so that we can kind of work our way past some of those defensive mechanisms that would normally come out, and they come out in imposter syndrome, right? So, vital to the therapeutic investments, again, come by way of authenticity. One of the biggest things that we try to do is elicit trust, right? If I don't have the trust of the parents, and I don't earn the trust of the client, I have absolutely nothing. Again, here's another Qism that I tell all my clients. I think a lot of us think that I work in the wellness business. You'll put wellness first. I will say I work in the business of wellness. One thing that I was taught when I was coaching club soccer is we are all under one umbrella, but we are all kind of different entities. So when you walk into my office, first and foremost, it is my responsibility to kind of sell you on me. Why? Because if you don't have belief and trust, or you don't feel that you know me as a therapist, we're not going to get to trust, and we're not going to get to wellness. There's absolutely no chance. It doesn't matter how smart I am. It doesn't matter how great of a professor Dr. Peets was and how much knowledge she taught me. If I cannot elicit some sort of trust and connection, we're not getting to wellness at all whatsoever, which also means there will be no hope, because I'm going to meet all the defensive mechanisms that we build for ourselves to cover when we are vulnerable or when we feel that we are most exposed, which means effective treatment, even if it is effective, it has no chance. It has no chance at all. So it's vitally important that, again, any of you that are coming to the therapeutic space, that your expectations and what you think you know is in a good place. I would also encourage, please make sure that you guys are actually being a little bit of judgmental to your therapist. Why? Because it's okay if you don't find the right therapist on the first go. I'm not going to fit for every client that walks through my door. God knows that I try, but not everybody is going to like me, which again affects the effectiveness and the hope and the trust. And that's okay. It's part of the business. But I do think sometimes our teenagers, again, especially our youngins that come in, it has to be one size fits all. So to the mom and dads of the world, if your son or daughter says, I'm not very sure about this clinician, don't panic. That's okay. Because if they can't secure that attachment with them, if they can't bolster that I can see something in this person, I can foster good work in their work environment, in their workspace, I feel like they can hear me and that I can relate to them, none of that will be effective. So again, part of what we do is our focus is building trust. Like I said, getting the client to buy in, commitment, long-term investment. Sometimes I see clients for 2 weeks. Sometimes I see clients for 2 years. Sometimes I'll see clients for 6 months. Then they'll go away. and sometimes they come back. It kind of ebbs and flows. What do I typically see in the adolescent, middle school, high school population? Right now, we're in an ebb, right? We're marginally into the first quarter of the year. Lacrosse, cross country, track, theater, and all these other programs are on the rise. Everybody has New Year's resolutions. My mental health is no longer real. Vitamin D, because spring is coming back, is here. I'm good. There's an ebb. Sooner rather than later, everybody reminds themselves that mental health just doesn't go away like that, and then everybody comes running back to my office. Q, I need to see you. Q, I need to see you. Then summer comes, we get in another ebb. Why? Because all of us or all of our kids are off school, everybody from college is out, I'm trying to go, it's vacation time, there's no real sports commitments unless you're doing some sort of AAU something. It's kind of an ebb. School starts again, there's kind of an uptick, right? So for us as therapists, we have to be very mindful of those ebbs and flows and be very patient with our clients. We never try to push our clients out before they're ready, but we also understand that life just ebbs and flows. So again, being authentic, building that trust, building that buy-in for me, it allows those clients to know that they can ebb and flow in our treatment plan. That when the time is right for them to return, they return. We pick up on the work that we left off on. When they feel that they're in a good place, I let them go. So I'm always grateful when people return, but I'm always grateful when, again, to be honest, I don't ever see them again, right? That's the goal. Elicit hope. I think hope is mightily important. I think we live in a world where hope sometimes feels like it will never come. So anytime, and I'm talking about any client, they come in my office, just kind of how I'm presenting myself, I hope you guys can tell that at times I'm very straightforward. I'm going to be straightforward with my clients. I believe that realness is the way, having real conversation. That is the only way I can help somebody, is if I can get them in a vulnerable space to be real, to be honest, so that I can elicit hope. And a lot of us do have shame. A lot of us do have guilt, whether that's on a spiritual level, whether that's on a personal level, whether that's on a community level. It plays a mighty, massive role in why, at times, people will not come into my office and they need help the most. And then even if they do come into my office, they come into my office very hesitant. They don't believe that this process can work. They don't understand exactly what it's going to take. So again, first and foremost, my biggest goal is just to remind anybody that comes in my office that no matter how hard it is, it's possible. If I don't believe it's possible, why would I ask them to? And why would they be able to look at me in my eye and trust what I'm saying? And I always throw this caveat out, right? Another Qism. I might not be right, but I might not be wrong either. It's going one or two ways. But that's because it's not my job to manipulate the client. I never want to manipulate. It's not my job to make the client to be a version of myself. It's never my job to steal their voice, to steal their agency of change. It is only my job to be a stepping stone to empower them. So anytime a client asks me the trap door of a question, anytime a teenager will ask me, hey, Q, what would you do? I don't know. You don't want to know what I would do. Why? Because at no point in time do I want you leaving my office saying, well, this was successful because my therapist told me to. I become the source of why they were hopeful or why they made change. I don't ever want to be the source. You know, being at a Catholic university, I think, Father would say, you want God to be the source. I don't want to be the source. I want you to be the source. So hope is very crucial and important to everything that we do in the therapeutic space. So some effective treatments, right? This is a little bit more information for you guys on what we do or what I do specifically. I'm very slow to diagnose. Why? Because I know that when people come to my office on first, second, or third session, I might not get everything, They're still trying to feel me out. I'm still trying to feel them out. If you've ever driven past a General Shepherd over on the corner of Everhard and Main, we work in 2 Tudor 1950 old school houses. They are literally houses. So I'm very blessed to work in an environment that is warm off the get-go. I can't say that for all of my colleagues, but I'm very blessed to live in or to work in a very nice, welcoming, warm, homey environment. But again, when people come in, they come in hesitant. They're unsure. They're uncertain. One of the first questions I also ask of people is, what has your experience been with therapy? So I understand. Some people are going to say, yeah, I was forced to go when I was a kid. Some people are going to say, this is my first time being in therapy. Sometimes people are going to say, yeah, I had a really good therapist, but that person has retired or they have moved or changed companies. Right? That's a lot of pressure. So I want to be patient in the way that I look at them. One thing that, again, I always reference Dr. Peets because she means the world to me. She gave me a life. She gave me everything. She gave me a world of skill set to be able to stand here and talk to you guys today. The one thing that she taught me was, hey, Q, you always got to remember, you got to look at the biological, the psychological, and the sociological person. You got to look at them in a holistic view. Because if I miss something in that holistic view, my assessment process is not going to be very good, and I'm going to miss important things. When it specifically comes to teenagers and parents, the one thing that I tell them above all else when they come in, rapid fire, hot, they want some sort of piece that fits what's going on with their child, their son, their daughter. I have to remind them, hey, they're just living life too. Sometimes this isn't crossing a clinical threshold. Sometimes the depression they feel, yeah, it presents itself as depression, but remember, they're 12. Remember, they're a freshman in high school. They're in a completely new environment. Again, I'm a man of analogies, even if you're not a sports player. If you stood in the MLB batter's box and took the Cy Young Award top winning pitch and you said, throw me a 110-mile-an-hour fastball. Is any of us hitting that? Because I know I'm not. I'm not even getting close. That's what being a teenager is at times. It's a 110-mile-an-hour fastball. But sometimes we get so caught up in, yes, there's something going on. What is this? I need this piece. Is it depression? Is it ADHD? Are they bipolar? Are they autistic? We start throwing around all these labels, and sometimes it's just lifing. And we have to be mindful that life is going to life, and it's going to ebb and flow. And if I get that wrong, I can make a problem. Let me say that again. As a therapist, I can manufacture a problem because that's the power that I wield in my office. And if I'm not respectful of that power that I wield, if I'm not respectful of that respect, I can start a pattern that will trail that client for the rest of their life. Why? Because we're in a moment of desperation and we need something that fits. Why? Because Q, I'm tired. Mom and Dad, I know you're tired, but this is just part of the process. Q, I don't like the process. I know I don't like what it looks like either. Right? Remember, guys, I got an 8-month-old at home and a 2.5-year-old. So half the time when I'm talking to all my parents, I'm like, hey, I'll be there in about 10 to 12 years. Don't worry. I'm going to be suffering along with you. It's just part of the process, right? Again, working within our scope of practice, I think that is vitally important. I'm presenting one side of therapy to you guys today, the side that is most authentic and most meaningful to me and how I see it. But again, the other colleagues that will follow after me, they're going to speak to it in their own light. Please always remember, that doesn't make me better than anybody else. I'm not better. I'm not more relatable. I'm just doing it the way that I know best. And that's staying in my own lane, staying in my scope of practice. Again, I'm more forward, I will tell you that. I'm more driving. There is a documentary on Netflix, it's called Stutz. It's with Jonah Hill. He has an interview with his psychiatrist, Phil Stutz. I watched this, and for a moment, I was like, I'm going to watch this for enjoyment. And then about 5 minutes in, I said, I'm not watching this for enjoyment. I need to study what's going on in here. And I also tell some of my clients at times, like, hey, you should watch a little bit of this documentary because you can see some things that are very important for a client to know about what therapy is like. And one thing that Stutz said that always stuck out to me is we can talk about empathy, we can talk about understanding, we can hear, we can reflect feelings, use all of our skill sets, but I want to leave the client with something. I want them walking out of my office with something tangible that can elicit change for them. That's the most important thing. So I tend to be more pushy as a therapist and a bit more direct. A little bit of that is my athletic side that I warn people about. A little bit of that is my competitive side that I also warn people about. But at the end of the day, therapy is hard work. It's hard work for everybody involved. It's hard work for me to have to listen and hear what you bring into my office and what you offload. But it's also hard work for you. Again, just like Kobe said, you have to suffer to win. I don't know about y'all, but I play to win. And I want my clients to win. Every time they come in my office, I want my teenagers, I want my adolescents to be able to be more secure when they're going through everything that has to do with high school, or when they're going through everything that has to do with standardized testing, or when they're feeling judged because they're not developing at the rate of the rest of their peers and they're becoming more aware of themselves and aware of the world. I have to push them out of their comfort zone a little bit, because if I don't, I know what the consequences are. Sometimes I think we come into a situation where I will always tell a client, well, you're not paying me not to do something. You're paying me to help. That's what I'm here for. I'm here to help you be the best version of yourself. And again, the more authentic I become and the less imposter syndrome I have, the more I can help my clients settle into comfort, the more we can get to wellness. The pendulum of balance with the power of intention. This is a fully fledged Qism. The pendulum of balance. I talk to a lot of people about being mindful of balance. So if you think of a window, you just think of a pendulum swinging between the window, as long as you're within the window, you more than likely are in balance. Yes, the window is going to ebb and flow, the pendulum is going to ebb and flow, but within your boundaries, you're going to be within balance. I think at times, even myself, we can get caught in extremes. Well, this didn't work, so I'm going to swing over here. Well, that didn't work, so now I'm going to swing back to the other side. And we never, at times, catch ourselves in the middle of the window where we have room to navigate and swing and have some ebb and some flow. So when I talk to people about being intentional, especially our youth, hey, if you're going to come here, and I know sometimes you don't want to be here, let's make use of our time. So yes, I will open the door up to mom and dad. I'll say, Mom and Dad, if they're still in the first session, what are we working on here? What do you guys want to see us get out of it? And then if mom and dad would excuse themselves after they understand who I am and what I'm about and what I do, hopefully they excuse themselves, and I'm going to look at that child and say, hey, I know what mom and dad said, but what do you want to work on? Because whatever you want to work on and whatever you want to talk about is exactly what I want to work on, and it's exactly what I want to talk about. I'm going to say something that's very real. Y'all don't care what I want to talk about as a therapist. Y'all don't walk in my office wanting to talk about what I want to talk about. You want to talk about what you want to talk about. No one ever wants to hear what I have to say. You want to be able to have space for you to say what is on your head and on your heart, which means so do our young folks. And I need to provide them that space. And through providing them that space and getting them in an intentional place of balance, the intention becomes at the highest level. So we work hard when we're in my office, and then, hey, go ahead and have some fun, but think about it a little by little. 1% better every day. I didn't say 10, I didn't say 25, I didn't say 75, I said 1% better every day. So that's intentional balance. When it's time to work, let's work. When it's time to have fun, let's have some fun. It's one of the biggest concepts that I try to preach in my office. Self-care. So for us as professionals, one of the biggest things that we have to do is care for ourselves. I'm going to say that again. Us as professionals, and I'm not just talking about mental health. Every one of you are a professional probably in your own right and in your own respect. If you don't take care of yourself, if you don't find time for yourself, man, we just burn out. And that's the same thing for us as therapists. So I'll disclose, this is what I tell all my clients. You come into my office, you'll see that there's a little 4-iron golf club in the corner of the office. I have plenty of space, high ceilings. I say anytime you see my doors open, if you see that I'm sitting there either doing notes or you're going to see me swinging this golf club over here. Why? Because when I get a moment in time in my after-career life of sports and playing here at Walsh and being a soccer guy, golf is my outlet. If my wife was sitting right here, she'd say, I'm going to kill him because all he wants to do is golf. This is what it is. I'm always thinking about golf. I'm always working on my golf game. But the thing about golf for me is it's the one thing of reminding me of how I can relate to the client. Why? Because I suck. And when you suck at golf, it's not fun, right? If any of you guys have ever gone to golf and you've ever tried to hit a golf ball, even if it's top golf and it goes like, that's not a great feeling. But how you act in this game of golf speaks volumes because it's a mental game. When you make a mistake, you have to rebound very quickly. You have to always work at it. You have to always be focused. So for me, when I step on a golf course and all the people, Wednesday, it was 60 degrees out. So y'all know where I want to be right now. I want to be on some green pastures. Don't even want to be here. I'm comical in that way. They know that I love them and I want to be there. But yeah, I want to be out there taking care of myself. And that's the same thing I have to tell my teenagers. They get so wrapped up in, well, I have an ACT and I need to get A's and I got to be the best sports player, or I got too much homework to do and I got 3, 4. I understand. I do. But back to my slide earlier, the one just right before this, the pendulum of balance, is we have to have intentional balance. I've heard too many people and too many valedictorians say that, yeah, I might have gotten a 5.3 GPA and I might be going to Harvard, but I missed an entire 4 years of high school. An entire 4 years that I can't get back. Yeah, I may have been all-state this, D1 recruit this, but I never went to a prom. I never went on a date. I never had those memories and moments of going to the Friday night football games and painting my face with my friends. Whenever they get done with that thing, they're going to be lost and they're going to come into my office. Why? Because they're not going to know themselves. And they're going to trade that thing for work. And if you don't work in a position that you love, or you work in a position that you love, work can take everything from you. Because we're going to give everything to work. We're going to give everything to finances, because finances takes care of our lives. And then if we have kids, we're going to give everything to our kids, rightfully so. But you know what the problem with that is? We're forgetting about the care. We're forgetting about the self element. All the adults in here at some point in time have probably looked at themselves and said, man, I should probably get a workout in. I haven't worked out in a while. I should probably go out and take a walk. And then as soon as you say that, you say, but I got to do blah, 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 blah. And all of a sudden, the good health that you would get from taking care of yourself so that you don't drop the most important balls in your life just goes by the wayside, and we just kick it down the road until it becomes undeniable. I have to remind my teenagers of this every single time. Hey, we need to be balanced. Hey, you need to maybe read a book. Why don't you draw something? Why don't you put your cell phone down? Why don't you get off Snapchat for a little bit? Why don't you, and I know I sound old school, I'm 33, I ain't old, but I grew up in a time where you get a little bit of that millennial traditionalism and some of the new wave of thinking and technology. But one of the most important things that I had in my childhood was going outside. How many of our kids go outside right now? How many of our high schoolers are going outside hanging out? I had a conversation with a client. He said, Q, I have all this acreage in the back of my yard for a bonfire. The kids could be like acres away. Nah, they just want to be in the house. They're just texting each other. I'm like, yeah, man, I don't know. It doesn't make sense to me either. It's those little things that when we become adults, become the DNA and the lifeblood of caring for ourselves. So again, part of my job is to teach. I'm a teacher. Part of my job is to educate. Part of my job is to be patient. Part of my job is to help build and develop skill sets that will not only work today, but they work tomorrow. And self-care is one of those non-negotiables. And again, to end it, it's a journey. You guys are seeing me at a time in my journey where to say that I would have been sitting here or standing here and speaking to you guys and speaking on a campus that I stepped foot on back in 1999 when my brother came here and I was 9 years old, that's a lie. That's a straight lie. To tell you that I would have gone back to school and got a master's degree, that's also a lie. Dr. Peets knows this very well. I went to Jackson High School. I had an IEP. I got a 16 and 17 on my ACT. I couldn't even get into this university. I probably got under a 2.6 GPA, and I was a soccer player. I have no business being here. I had no business being here until I made it happen. It's a journey. This life is a journey. Every phase and every stage of it is a journey, and sometimes that can be scary. Even for our, I'm not saying you're old, but even for the older folks in here, I'm not saying you're old. Y'all are still learning something about life, right? To put the little spiritual spin on it just for a brief moment, that's because that's how God designed it to be. He designed it to be, we come in and we're dependent. As we get a little bit older, we start to get more independent. We start walking. We start crawling. Now we start running. We know a little bit of nothing. And then in our teen years, we get hit with an onslaught of everything. Our perspective, our lens, our vision, it expands. We fall in love really quick. We hate really quick. We love what we're doing. We hate what we're doing. He's my best friend. She's my best friend. Nah, she's the scum of the earth. Don't look at me. Don't talk to me. Then we graduate high school and we get into a phase where I think I'm supposed to know what I'm supposed to do. But guess what, y'all? I don't really know what I'm supposed to do, and I don't know what I'm supposed to do on this college campus. Help. Then all of a sudden we're expected in our mid-20s to really have it together. Hey, you're supposed to be in your career field. You're supposed to potentially be in a long-term committed relationship. And then all of a sudden you're hit with finances, mortgage payments, car payments, hospital bills if you're having kids, etc. Now I'm trying to build wealth. I'm trying to figure it out. That's 30 to 40, 45 years old. Now I'm running all over Kingdom Come depending on what my kids are doing. We're taking vacations. Oh, by the way, me and my wife haven't talked in forever, so now I'm coming into Q's office because we're not connected anymore because we've given up so much time to our kids, and all of a sudden we're staring retirement in the face. And retirement is supposed to be glorious. I'm supposed to have all the finances in place. Now is the time to enjoy my life. But the question is how much did you enjoy the process? Too many times I do see people where they surrender and sacrifice everything. But always remember, the more you sacrifice everything, by the time you get to that thing, you're going to experience it completely different than the way it was intended. So here's a great example. As a soccer fan, I would love to go to London, England, and watch my favorite team, Arsenal, play. Now with 2 kids, that's either going to happen with me and my wife leaving the kids at home, which is going to probably be the ideal experience of how I conceptualized it since I was a kid. Or if we wait 10 years till we have a 12-year-old and a 10-year-old, that experience is going to be completely different. Doesn't mean it's going to be worse, but it means I'm going to run conflict with how I conceptualized it to be versus what it became because I waited so long. This is a marathon. As a professional, I'm running a marathon. As a client, y'all are running a marathon. There will be phases of sprinting. There are phases when my clients come in the office, they feel really good, really quick. We're confronting some good things. I'm helping them cope. They're looking and perceiving things very different. And then they run into a brick wall. They look at me and they go, Q, what happened? I said, well, we built up some good momentum, and we've probably come to a position where we're getting into the depths of the hardest things to deal with. So hopefully, if I can impart anything onto you guys today, is just to remember to enjoy the journey, because that's what it is. There's going to be phases where we have it. There's going to be phases where it's a lot tougher, and that's okay. So, yeah, man, thank you for your time. It's a blessing to be here and to speak to all of you. Very thankful and fortunate. Thank you, Dr. Peets, and thank you, guys.
Okay, thank you, Q. What a great start to the day. And I'm not going to say that I'm old, but I learned a lot. Q, I learned a lot today. Lots of thought-provoking things, things for deep reflection, and you got the momentum going for the day. And we're going to enjoy this journey, as Q said, because we have other great speakers. But one more round of applause for Q. And I'm going to introduce our next great speaker. So if the speaker wants to come on up. I know in the room today we have a lot of students, we have a lot of supervisors, and we have educators, among many others. And I always think it's so exciting how we all learn from one another. I think there's a lot of supervisors in here that can say, I learned a lot from my supervisee. And I know from being an educator, even if you're in your first semester, educators learn a lot from their students. So let's keep the conversations going. And we have Autumn Brown. So Autumn Brown is a licensed professional counselor. She also did the school counseling master's program, as well as clinical mental health. And she specializes in working with clients who struggle with addiction, anxiety, depression, and mood disorders, and other concerns. Autumn has her history in working with women, students, and those with dual diagnosis. So welcome, Autumn.
Okay, so putting it out there, I'm really nervous, so take it easy on me, okay? So I am going to be talking about current issues that adolescents are facing and the impacts that it has on mental health and well-being. So just a quick overview of things I want to talk about today. I want to go and introduce myself, talk about some statistics, some diagnoses and current issues that I see, as well as interventions that I like to use with my clients. And then lastly, social media and the post-pandemic effects that we see on adolescents. So a little bit of background on me. I went to school for undergrad at Kent State University. I graduated with a bachelor's of science in psychology. I then went straight on to here at Walsh University, and I did my program in counseling and human development, so I have my master's of arts. I did do the dual program here, so I did, oh, I have to click it too. I forgot about that, sorry. So I did a dual program here, so I got my master's in clinical mental health counseling as well as school counseling. So I am now a licensed professional counselor in the state of Ohio, and So I have like my LPC. So some experience that I have, my very first experience with mental health was at CHC Addiction Services. I started there in 2021. This program, I specifically worked with a program with women, and it was a treatment center, a partial hospitalization treatment center with supportive housing. So it looked and operated as if it was residential, but it was PHP. I did start as an RA there, and then I did move into internship, and then they did end up hiring me after that. During that same exact time, I also did an internship at Green Intermediate School because I do have the school counseling degree as well. So I was an intern there in 2021 to 2022. So this was pretty unique because it was the first full year back into school after COVID. So I saw a lot of effects of that the children were facing and the adolescents were facing. And then I also did outpatient therapy there. So that leads me to my next experience is at Center for Renewed Minds. I did outpatient therapy there, and since I had that relationship with Green, and since I had that already build rapport with that demographic, and I had a caseload there that I was working with, so they did let me come into the school and continue seeing clients, and then I also picked up some more because there was such a high need. And lastly, that brings me to my most recent job, that is at Ellie Mental Health in Hudson. It is a private practice, and I am a clinical mental health therapist there, and we opened recently last year. So I want to start by sharing what is an adolescent, because I think a lot of people get confused on this. So according to the World Health Organization, an adolescent is, I have to click it, guys, sorry. I keep forgetting that. I'm doing it on my thing, but not on here. So an adolescent is a phase of life between childhood and adulthood. So it is the years between 10 and 19. For the purpose of my speech today and like what I'm going to be talking about in this presentation, I'll be focusing on ages 12 to 18 years old. I chose that because I currently don't see anybody under the age of 12. That is my cutoff, and I ironically don't have any 19-year-olds on my caseload. So going into a little bit of background and the prevalence of mental health, I found that the Mental Health of America did a youth ranking for the year of 2023. So what they found was that based on 7 measures, they ranked all of the 50 states, well, there's 51 because they do count the District of Columbia, from 1 to 51. So they ranked these states based on 7 measures, and those measures are listed up here. So they did 1 major depressive episode, substance use disorder, a severe major depressive episode, a major depressive episode and no services. So that includes like no psychiatry, no counseling, no mental health support. A major depressive episode and some consistent treatment. I think keyword here is some, not consistent all the time, but that would be like psychiatry appointments, mental health services, counseling, things like that. And then private insurance that did not cover mental or emotional issues, as well as students who identified with an emotional disturbance or was on an individualized educational plan, also known as an IEP. So after that, they ranked all of these states, and the lower ranking states, so these are the the like better states, I should say, are ranked in a way that they have a lower prevalence of mental health and a higher access to services. The other end of the spectrum, the higher ranking states, they had a higher need for mental health, a higher prevalence of mental health, and not as many services available, so lower services. So based on that, I did list some states on here. So the best state in the country is the District of Columbia. So according to this scale, the District of Columbia has the lowest mental health prevalence in our country and the highest access to care. State ranked number 2 is Delaware, similar results. And then on the other end is state number 50, which has a very high need of mental health and a very low need to access of care, is Kansas. And then rated the worst is state number 51, which is Oregon. So you can see that Ohio is number 27. So I know a lot of you are probably thinking like, we're in the middle, we're not too bad, but actually according to this, any state ranked over a 13 is considered bad and needs help. So I think this shows that like we might think that we have that midline, but it really in perspective, it's not. So I want to go into common symptoms that are seen with mental health, common symptoms seen in mental health with youth and adolescents. So most commonly reported symptoms include substance use, a loss of interest, recent isolation, performance decrease, and mood changes. So further diving into this study, Sandstone Care sent out a survey and gathered information about mental health from teens and their family members. So they sent out surveys and responses were separated into either self-report by the teen or by a family member. The survey asked 5 questions and it was used on a 5-point scale. So 1 being the least concern and 5 being most concern. When the results came in and if any student or teen had reported an answer of yes or a high concern to 2 or more questions, then they were then contacted, the family was involved, and they were referred for mental health services. The scales that they used, the questions that they sent out were, are you no longer as interested in the stuff that you used to enjoy? Have you been isolating yourself from others more than usual? Have you noticed a decrease in your performance at school or at work? Have you been noticing distinct mood changes? And have you been using mood-altering substances to cope with depression, trauma, or anxiety? So based on the results, the top graph here shows that the most reported on symptoms were isolation and mood changes. Mood changes was ranked number 1, and isolation was very short behind, ranked number 2. Now, the bottom graph shows that what family members or loved ones had reported on their teens. And you can see that this survey by the family members were also supported in showing that mood changes were the highest symptom noticed. And then you can also see that loss of interest, recent isolation, and a decrease in performance are all pretty tied and very commonly reported as well. And the last point on here, teens were seen to take the survey quicker than adults. So I think this is an important statistic, and I think that this is interesting because I think that what this could mean is that teens are more in tune with their mental health. They're more in tune with the things that they experience. They are also more willing to report on them. There's not a bias or a scarcity there, and as well as they are more open to getting that help that they need and discussing the things that they need. So I think knowing these statistics can help because we can help teens, parents, healthcare providers, and society understand how mental health is seen and how it is most commonly reported. So I went through my caseload and I tallied all of my adolescent clients. So again, ranges 12 to 18. You can see that I also listed diagnoses and current issues that I'm seeing. I'm not going to go into all of these, but I am going to talk about some highlighted ones that I do want to touch base on. So out of my 23 adolescent clients currently on my caseload, the most average age I see is 14. Now, I think this is interesting because that is the phase between middle school and high school. So those are the 7th and 8th grade year, big transitions, a lot of new things. Then the next column, diagnoses, I went through and highlighted my most seen diagnoses. Now, I agree with what Q had said earlier. It's hard to diagnose, and I don't like to diagnose, but unfortunately, the way that we have to do it is we have to diagnose in order to be reimbursed through insurance. So I always like to diagnose easier and then get to know that client and then really evaluate like what I feel is a true and genuine diagnosis for them. So most commonly, generalized anxiety disorder. I have 10 of my 23 clients that are diagnosed with this. ADHD, 7 out of 23, very common diagnosis, as well as other specified trauma or stress-related disorders. Now, this is a lower number, but I wanted to touch base because I think that this is interesting. So what this diagnosis means is that it's not a full PTSD diagnosis. They don't meet criteria for that. They also don't meet the full time frame of an adjustment disorder, which is like going through these phases of life. So I like to use this diagnosis because it is other specified, meaning it is not a full-blown one disorder or the other. It is kind of like a preliminary of this is where I could see it possibly going. Major depressive disorder, I have 7 of 23 clients, and my adolescent clients diagnosed with that. And then lastly, at the bottom, multiple diagnoses. I have 7 of 23 that have multiple diagnoses. Most commonly, I see paired generalized anxiety, major depression, as well as ADHD tied in there. Current issues that I see with my caseload, a lot of them are on here. I do just want to talk about the lack of support at home or within the school. A lot of my students are reporting that they are not feeling validated by their parents. They're not feeling supported. They're feeling that their reality is not real. They're often told that they're overdramatic or life really is not that bad. As well as seen in the school, a lot of students are reporting that they don't feel comfortable going to their school counselor or going to their teacher. They feel that there's a disconnect there, that they don't have a trusting relationship with those people at all times. Parental stressors and family dysfunction. So a lot of my clients report that the stress comes from their parents. We have a lot of pressure, a lot of judgment, comparison between siblings, as well as family dysfunction. There is a lot of just overall history within a family, and it is sometimes hard for an adolescent to adjust to that, especially if as they're growing, they're not in agreement with what is happening. Peer pressure is a big one. If you look up a couple behavioral concerns is on there. Peer pressure leads to a lot of behavioral concerns. A lot of people will fall into peer pressure. They are engaging in risky behaviors. They're doing things that they typically wouldn't do, things that they feel they shouldn't be doing, but they feel a need to fit in. And I think that ties in with social media influence, and I'm going to talk more about that later, so I'm not going to touch too much on it now, as well as post-pandemic stressors. So some interventions, recommendations, and referrals that I use. Therapy and interventions, I love to use cognitive behavioral therapy with my clients, also known as CBT. This is a type of therapy that challenges maladaptive or negative thinking patterns and tries to create change. So, like utilizing thoughts, behaviors, and how they impact emotions. Dialectical behavioral therapy, DBT, this is very closely aligned with CBT. This is all about accepting that change and accepting the thinking patterns that we have, accepting the thoughts, the feelings, the behaviors, and using skills to come to that acceptance. It's also about emotion identification and regulation, as well as interpersonal relationships. Motivational interviewing, I love to use this with my clients. This is the type of interviewing that you would do whenever you are trying to help somebody come to a decision. A lot of teens are reporting that they feel caught in the middle. They don't know what they want to do. This is a time in life where they have to start making decisions, and they feel that they're at a crossroad. Person-centered therapy or Rogerian therapy, this is a humanistic type of style. It is helping the client to become their highest potential, to feel autonomous, as well as meeting them where they're at. I'm not expecting them to be where I want them to be. I'm accepting them as they are, and we're going to work on what they would like. Also, a sense of greater independence. I do occasionally refer out, so some reasons I would do this is if there is a need for a higher level of care, like intensive outpatient or partial hospitalization program. Also refer to psychiatry if needed, and then also for psychological evaluation or assessment. Typically this is seen whenever you want an assessment based on autism or ADHD, those neurodivergencies. Assessment measures that are typically used with adolescents is the PHQ-A. So this is a questionnaire that they fill out based on their anxiety, depression, overall mood instability. The MMPI-A is a personality assessment. It gives characteristics, personality traits, as well as factors that could be an influence of how their personality is. And then the youth self-report, this is a good one because the client reports their behaviors, they're reporting how they feel, they're reporting what they think their need is, so it's insightful to see that. And then the Beck Depression Inventory, which is pretty self-explanatory, assesses depression. So some recommendations that I'd give to my families or to my students themselves, I really like to use a token economy. So what this includes is we have like a target behavior, and then we will reinforce that behavior based on a reward. So for example, if our target is to have a student come home and do 2 hours of homework. If they complete that task, we're going to give them a token. Oftentimes it's like a ticket or a tally or a coin or something. And then when they earn enough to buy something back, they will get that reward. So like a trip to the store, ice cream, things like that. Behavioral chart, kind of in line. We put them on a behavioral chart to reinforce behaviors in a positive or a negative way. And then routine or sleep charts. I actually use this a lot because a lot of my teens don't know what healthy sleep looks like. They don't understand that going to bed at 3 a.m. and then waking up at 7 is not acceptable, and it's not okay for whenever you're trying to retain all this information and sit in a classroom for 8 hours a day. Screen time goals, I really like this because I will create challenges with my clients, and then I also will pull out my screen time. I actually did this with my mom the other day, and her screen time was way more than mine, so I thought that was pretty good. And then family time and relationship building. I really like to encourage the parents to meet with their child alone, take that designated and intentional time, speak with them, and not have any siblings involved, not have any other parents or any other family members involved. It's intentional time with that client. So moving into the impacts of social media. Social media is, everybody uses it. We all are guilty of it. It does pose a distraction. It leads to concentration issues. There is an increase in instant gratification and in the immediacy because we live in a world of now and we want everything now. We have the world basically in our fingertips. It also leads to a lack of participation and functioning, like school, homework, sports, engaging in activities after school, family time, getting good amounts of sleep. There also is an exposure to too much information. Adolescents should not be exposed to things that are going on at the rate at which they are. So our adolescent minds even able to keep up with the amount of information and the intensity of information that they are exposed to. Everything is just being thrown at them, and oftentimes we're reading it or we're digesting it before we can even scroll or swipe. Increase in unrealistic views of the self, others, and the world. So this can lead to over-dramatizations and over-generalizations. So what I mean by that is if somebody comments something negative on my post, everybody hates me. Or if I am not a particular size, I am not worthy of having love. Or if everyone I see is posting happy things on social media and no one is posting bad, then I'm alone in how I feel and I'm all by myself. Nobody relates to me. This can lead to an increase in low self-esteem and a decrease in confidence, especially in teenage girls, as well as the big one, cyberbullying. There are measures that social media tries to take. I know especially like Instagram and Facebook, they have like Facebook jail and you get deactivated at times, but it's at such a fast pace that it's hard to keep up with, and it does happen. Another interesting thing that I didn't realize, but I learned this when I was at Green Intermediate School, was that if there is cyberbullying going on outside of the school cannot get involved. So unless it's taking place on campus or it is directly because of something that involves like a teacher or a staff member, the school cannot get involved. The child is told, well, maybe you should delete social media or maybe you should get out of that group chat. There is not much that there can be done. And this can lead to depression, anxiety, eating disorders, and isolation. So the big point here is social media can directly impact mental health when it is over and misused. Again, very important note is especially in teenage girls. So I found this chart that I thought was interesting because it does show the increase in social media over time. So the header here is majority of teens are using YouTube, TikTok, Instagram, and Snapchat. And they saw a decrease in Facebook. Now they're like, oh, there's a decrease. But if you look, this was taken in 2014 and 2015, and then again in 2022. There is an increase in social media overall. There are more platforms that were not really used in 2014 or 2015. So there is a social media increase, as well as there are more platforms now. Also an interesting note is they have TikTok ranked lower than YouTube, and I would actually pose now that TikTok is probably equivalent, if not higher. So there is a decrease in Facebook overall, But I think that this shows how normal social media is becoming and how normalized it is. So you are now considered the weird person if you're not sharing your life with strangers. You're considered the weirdo if you are only having a couple followers in your family. That's not the norm. So this is going to be a heavy topic, but the overdiagnosing on TikTok. So there are terms that are now used as adjectives to describe somebody. In my opinion, a diagnosis or a disorder is not an adjective to describe somebody. So there are trendy diagnoses. Most commonly seen is ADHD and autism. I even will open up my own social media, and the video will say, if you have this and this and this symptom, you probably have this disorder. And that's not okay because it's creating like a false narrative. Anxious avoidant attachment styles. This is so common. Kids are saying like, oh, I have a toxic relationship because of my attachment style. Or I like to be at home and isolate myself because of my attachment style. PTSD is so loosely used because somebody's teacher yells at them, oh, I have PTSD from that. That might have been a traumatic experience, but it is not a full-blown PTSD disorder. Personality disorders, a lot of people like to describe themselves with personality disorders. I'm not sure why, because there's a lot of negative connotation to them, but it's like a trend going on. As well as OCD. If somebody is too neat, or they like things a certain way, or they like things organized, it's like, oh, I have OCD. And then anxiety and depression. So why is this a concern? Well, symptoms look different in different phases of life. So a symptom is going to look different from a child to an adolescent to an adult to later adulthood. Also, symptoms are being self-assessed. They're not being observed by others. They're not being reported on by family members or teachers. They're being assessed by themselves on their phone, as well as they're not talking to a licensed professional or somebody who is in the field to get that difference of opinion. In school, we were taught to evaluate the person as a whole. We use the biopsychosocial model. So this is biology, genetics, brain, how the brain works, health factors, psychology, mental health, emotional wellness, previous diagnoses, what their behavior is like, and then social impacts, including family, peers, social interactions, how much they're engaged, what is their environment, what are they in. So I do want to say that not all social media is bad. It can provide a sense of community. It can normalize mental health conditions. It can also normalize medical conditions, help people feel included. It is a form of self-expression, so people have a platform to be creative. They can express themselves. They can share things that they're passionate of, that they're proud of, as well as seeking help and support. Social media is a great source of networking. It's a great source to feel connected to resources, and as well as it can be educational at times. I know there's a whole thing called TikTok University, and I have learned some things on TikTok, sadly, but I'm also an adult, so I think it's within reason. And then my last topic, post-COVID-19 pandemic trends. So as I said earlier, I was in Green Intermediate School during the first full school year back, and there was a huge increase in social media use. Kids were on their phone in school. They were having their phones taken away. This led to being less social and more comfortable with being alone. Sedentary behaviors and times. People call themselves couch potatoes, or I'm going to melt away in my couch. I'm going to binge watch Netflix for 10 hours. It's leading to behaviors that are isolating ourselves, whether we're intending to or not. An increase in procrastination. I had one client that told me she just never did her work because it was always accepted late. So she had no motivation to do things on time because of the platform that it was used on. It was just always there. There was no accountability. If a student didn't do their work, there was a reason why. They could say, oh, I was stressed, or this happened, I didn't have Wi-Fi. So things were so loose and unorganized. Also led to a reduced amount of school-based mental health services. So a lot of times students will see their counselor, their LPC, their licensed professional counselor, in the school. And when school was shut down, that was not happening. Yes, there is teletherapy, there is telehealth, but it is very hard to engage an adolescent on telehealth. It's oftentimes not like good in-person talk therapy. There is an increase in anxiety and depressive symptoms because of that. Kids weren't getting the counseling that they needed. It led to more sadness, more hopelessness, feelings of worry. Are we going to get out of this? Is there like a light to the end of the tunnel? and an internalization of problems. So what I mean by this is things were happening in my world, but I was making it about myself. So for example, if my family was worried about finances, that was my problem. If my dad wasn't going to work, I thought he was fired, and we're not doing okay, we're struggling as a family. Everything that these children were experiencing, they were taking on as their own, and as if they were their own problems. So it was like the weight of the world was on them. And then my last fact is I found a study that it scanned brains through MRIs, and it showed effects before COVID and after COVID. Now, these researchers were already scanning these brains before the pandemic had happened. They chose children or adolescents ages 13 to 17. And what they found was whenever they rescanned these brains, they invited all these patients back, and whenever they rescanned these brains, 10 months later, they had found on average the brain had aged 3 years. So they specifically found that there was a reduced cortical thickness, there was a larger hippocampal and amygdala volume, and there was a more advanced brain age overall. So not only did this increase mental health challenges, but this accelerated the brain aging. So I hear so often people saying, well, when I was 14, I didn't act like that, or I didn't do those things. Well, I believe that because the brain aged so much quicker than traditionally. So I think noting all of these things between social media, peer pressure, post-pandemic lifestyle, and cultural norms, it is so important to put the time, the resources, the focus, the dedication, and the effort into our youth and adolescents, as they are our next generation. I'm hopeful that as it progresses, we will have more mental health services. People will be more in tune with their emotions because it is a different generation, and I think they are more open and less scrutinized for it. So that is me. Thank you. I know, all right.
Thank you so much, Autumn. That was fantastic. I loved all the statistics, and I like the first speaker, which was kind of more experiential, and then this giving you a lot of details. So I love the contrast between those and a lot of good information. We are going to take a break right now. Couple things, though. Bathrooms are the easiest way to get to them is out these back doors. Both the women and men's bathrooms are back there. We have plenty of food, so please help yourself. God bless you. And then also, this is a great time to visit our community booths, and we will be back here in 15 minutes. Veronica's 4, Michaela 5. Yep. So, yeah. Okay, if everyone could return to their seats, we're going to go ahead and get started with the next part of our program. You guys are good. Wow, it got quiet really fast. I appreciate it. So as you can see, we have this lovely group of panelists up here. So we're going to introduce each one of them, and then Tiffany and myself will be firing questions at them. No, we will ask them kindly. They've been provided the list, so hopefully no shocking questions will come up. So first here is Claire, and Claire Killian, occupational therapist. Yay, OT. Okay, sorry, I just had to put that out there. She's currently employed by ABC Therapy, working primarily at Indian River Juvenile Detention Center. She is a Walsh 22 grad and participated in the COPE program. Next to her is Sharon Hoopengarner. She's a psychiatric nurse practitioner. Sharon works at Phoenix Rising and the Center for Renewed Minds. She's been a psychiatric mental health field practitioner for more than 20 years. Marissa Salazar is a licensed social worker who earned her MSSA from Case Western University and her BA from Malone University. She did tell me it was painful a little bit to be here today, but I'm really glad she allowed herself to participate. So we have her focus areas of treatment are for those struggling with anxiety, depression, grief, trauma, life adjustments, and children with behavioral issues. And I don't know if I mentioned that she works at Branches Counseling. And then Tiffany. Yep.
So next we have Veronica Gehring, and she is LPC. Veronica is a clinical mental health therapist. She specializes in working with adolescents, working with teens and adults, and her focus areas are anxiety, mood disorders, eating disorders, and body image concerns. Veronica actually attended Walsh University. She coached volleyball throughout her time here, and she did that while she was completing her master's program here at Walsh. Next we have Michaela Gibbons, and Michaela is also Walsh alum. She obtained her master's degree in clinical mental health counseling from Walsh, and she graduated also from Mount Union's physician assistant program very recently. With these combined master's degrees, she is highly interested in working as an assistant physician in women's health and psychiatry, and she wants to bring greater awareness to the connections between mental and physical health. Next, another Walsh alum, Kara Loomis. So Kara is, this is kind of interesting. She's actually involved in the grant that is the COPE grant. She's currently involved in it, so she's working on her second licensure here. So she has a bachelor's degree in early childhood education, early childhood special education from Walsh University. She also has her master's degree in school counseling, and she's currently working on her clinical mental health license. Karen currently works for the Early Learning Center at Schreiber as a school counselor for Canton City Schools. So these are our great panelists.
Yay! Don't go far. Okay. Okay. was like, don't run away. Okay, we're going to go ahead and get started with our first question. I think what we'll do is have a couple of you respond, and we'll proceed through the questions. But if you have something like really pressing that you want to contribute, definitely do that. So we'll start the first question here with Claire. What are the most significant social and emotional challenges faced by today's youth? And how have these changed in recent years? Hopefully they will get this to be on.
Can you guys hear me? Okay.
Yes.
Hello, everyone. I hate to start out on this note, but I work with kind of a niche population. So the reason why I have a job is because violence is very prevalent with our youth right now. Not to say that it wasn't prevalent before, but with social media, music all the time, I was just listening to a song on my way here that my youth listened to, and it was saying, like, we'll shoot you for nothing. So what I work with is violence prevention. I think a lot of times with social media and those trends that Ms. Brown was talking about, violence is a trend right now. The boys feel cool when they assault someone, when they shoot someone, and then they don't realize that that's a permanent decision. So not just school shootings and things like that, but in our communities, I hate to talk about it, but we have to. Violence is something that our teens are participating in, and unfortunately, that's a part of our reality.
Sharon, did you have anything to add? Sure.
I think it's already been mentioned by Anam. We have seen such an increase in anxiety with our teens, depression, especially since post-COVID, and of course with the rise of social media. I think one of the biggest challenges that teens face today is obviously trying to, as always, really in any generation, fit in, but get along with their parents. Grandparents right now are raising a lot of our teens, and even great-grandparents. I work with about 85–90% of our Medicaid population. Excuse me, so a lot of our families don't really have the resources to give these kids when needed. So they're just really out there experiencing a lot of different mood changes and really just trying to figure it out.
There should be a microphone for every two people. So that way we don't have to- Yeah, so if anybody else has anything to add that wasn't mentioned.
Yeah, and just going off of what Sharon and Autumn also said, I think social media is a really big issue. And then from my point of view, I do specialize in working with eating disorders, so something that I see greatly is just the impact of body image that social media does have on our youth too.
At the school level, I think we see a lot of like peer pressure and kind of what Veronica said with body image. If you're not in on the trends and up on the fashion or have the newest items, a lot of bullying comes in. And we see that at all levels. It starts as young as even at the preschool level. If your hair's not done a certain way, if you're not wearing certain clothes, kids start to attack you or single you out and see you as somebody who's different. So I think a lot of pressure is put on our youth and making them be shaped into things that maybe it's not who they really are.
Thank you. So a number of diverse issues that we're dealing with, and an excellent segue to the next question. So we've talked about all the issues that present with social media, so we're aware of technology and social media, and they can contribute to some positive and negative aspects of social being. But as professionals, here's the kicker. We want to know what strategies can be implemented to promote healthy online behaviors and mitigate some of these negative effects. So I don't know if anyone wants to start. So thinking about healthy behaviors to mitigate some of the negative aspects of technology.
So I'm a physician assistant in family medicine, so I get to see a little bit of everything going on in the patient's life. And one of the biggest things I feel like is that I also work in a very large low-income population as well, mostly Medicaid patients. And the presence of their parents or good support is not there. So when I'm seeing these kids, sometimes they're sitting in my office and they're sitting on their phone, they're scrolling while I'm trying to talk to them, and you can't get good conversation. And the parents equally are sitting beside them, just sitting on their phone, just very uninterested. I think it's been a big way that they're able to disassociate and not have to have these conversations that are tough. So I think from my perspective is trying to help the parents understand that we need to monitor what the kids are doing, but they also have to take a little bit of responsibility for what like actions that they're modeling back to them as well. And I think we talked about screen time. That's a big thing. iPhones especially pop up once weekly with screen time. And I get to sit there and ask them, what's your screen time? How many hours a day are you on there? And sometimes they're telling me it's 8 to 10 hours, which is crazy if you think about how often they're sitting on their phone. But there's some ways that we can implement reducing screen time just from the features on some of the phones now.
There's a difference between Android and iPhone. Android allows parents to and allows third parties to be able to view your phone. So there's a program called Bark. If you're not aware of it, every parent should have it on their phone. I know it's a little bit expensive. Verizon has one, AT&T has one as well. But Android cell phones allow parents and allow Bark to be able to view much more, especially Snapchat, whereas iPhones, Bark, or iPhone doesn't allow Bark to kind of get that information, so parents can't see it. And so I'm like, if you're going to give your child a phone, always go with Android. But I always tell my parents, you're responsible for what's on your child's phone. And so we don't think about that as sometimes as parents, like, oh, it's no big deal, like we can handle it. But whatever's on the contents on your child's phone, that's your responsibility as a parent. So I always tell my kids when they're like, why is my parent looking at through my phone? It's none of their business and I need privacy. I said, you don't have a job, you are not paying for this cell phone, so it is not yours to tell your parents when you're using it or when you can be viewed. So I always tell my parents, like, and my kids, it's your parents' responsibility to be your frontal lobe, and that's a part of looking through your phone.
Okay, I love that. I love hearing that come from a younger generation, because I'm a baby boomer. I am old Q, and it's okay. I don't mind being old. Yeah, I'll take you out after, yeah. So I've gone through many generational changes. But I'll be quite honest with you, to segue off what our physician assistant said, I don't allow phones when I'm interviewing clients. I tell them that they can keep them on, they can put them down if they want, and if they get an important phone call, let me know, or they need to text something, I will wait, and I will stop my interview. I do the exact same thing with the parent, because I think that it's our responsibility to role model, not only for our adolescents, but also for our children. A lot of times parents come in and, as I said, the population that I deal with, they're just under-resourced. Who knows, they could have trauma, or they're parenting the way they were parented, and it just continues to be generational. So I also see, not only is it my role, as Q said, to try to, and as a nurse practitioner, when I'm doing assessments, I have 45 to 50 minutes to establish a trusting communication, a role, therapeutic relationship, not only with the parent, but with the child, because I have to have a parent in the room. When I'm doing my assessment, there has to be a legal medical decision maker there when we're talking medications. So that's why I love my therapists, because I read your notes, because they'll tell you things that they won't tell me when mom and dad are sitting there. But anyways, I kind of went off topic. I'm sorry. But yeah, I actually have kids put their phones down, because I think it teaches them respect. That this is their time, not only my time, but I want to, utilize it the best that I can to help them.
The biggest source of revocation that we see at my facility is youth posting on Snapchat a picture with a gun, or lots of money, fancy cars, things like that, and their parole officer sees it and then they land themselves back in corrections. So the occupational therapists that I work with, we all run a group about Instagram versus reality, or Snapchat versus reality, and constantly just emphasizing that the things that you see and the things that even you are posting, they're not real life. We make them draw a picture of their last Instagram post that they remember posting. What did you look like in this picture? What were you really feeling that day? And they'll be very shocked. Like, yeah, you're right. I was really depressed this day, but I was smiling in my driveway and posting a picture with lots of money, but I didn't really have money because I was supporting my 5 siblings. I just cannot believe the looks on the boys' faces when I show them a picture of Kylie Jenner or Kim Kardashian without the Instagram touch-ups and things. They really do believe that what we're posting on social media is authentic, and just constantly reminding them that it's kind of like a movie. It's not real. It's kind of scripted in real life.
Yeah, and going off of that, I think it's important, as well as limiting social media, to also empower our clients to find creators that are showing like the stuff behind the scenes, not all the filtered things, and finding positive creators. I think that can be really empowering for them, considering they're probably not going to completely get rid of social media at this point. And so my thing is, I work with a lot of my clients in finding creators that do help them feel good, that do implement a healthy body image. And so I think that's something that we can help them with as well. And then also, I know we talked about, and Autumn touched on, just the misdiagnosis and stuff like that through social media, and how often clients will come in and say, I have this or this. And I think that's something that we can do as providers, is we can open that conversation, and instead of shaming them for doing so, we can have that conversation. What are you seeing? Why do you think that? And open that conversation up to work on it with them too. So.
At the school level, I work with the preschoolers. So obviously their access to social media is much limited to what young adolescents have. But there are features on the iPads and the computers that teachers and the adults that are in the classrooms can use. We use a lot of, it's called guided access. And so essentially, once we get a student into the app that they're supposed to be in, we can click the home button 3 times, and then it will lock them into that app so that they're not going on the internet, because speech to text is their favorite thing. And so it only picks up some of what they're saying. So they could be saying one thing, but it brings up something that's another. So it could be inappropriate or appropriate what they're finding. So using guided access really helps limit their availability to the internet. And then also teachers can use an Apple Classroom, and they can actually see all of the screens that are connected to their classroom. So they can see what the students are doing while they're on the other side, and they can still do their work, but also see that the students are doing their work. They can lock the students' iPads, their tablets, their computers, things like that. So they have access to all of that as well.
Okay, I have something pressing to add. Does anybody know what the American Psychiatric Association, the amount of time that they recommend screen time for teens? Does anybody read that? Anybody want to take a guess? 2 hours. 2 hours a day. And the reason behind that is because studies have shown that we are developing and growing ADHD brains. And this is why we're seeing the rise of the ADHD diagnosis, is because the neuroplasticity and the neurocircuitry of the brain that's growing, these brains are growing until they're 25. So if you think about when that brain is growing and it's not staying on one thing, when they're swiping, they're going from one thing to another, to another, to another, to another. Well, that pretty much starts to look like an ADHD brain, doesn't it? I can't focus, I can't concentrate, because those neural pathways now are starting to grow and form that way.
All right, the next question, maybe we'll start at the other end down there with Kara, because this is actually academic, and then kind of work our way back. Are there specific strategies to create a more supportive academic environment that fosters emotional well-being?
I think creating a safe space for your students and for the individuals that are coming in to see you. I know I work really closely with our special education team at the school that I work at, and I just like to create that safe space for them so that they can come and kind of be themselves and express what they want to do. Canton City does a really good job of having a career tech education program that allows students to try new things. They can try tech, they can try construction, hair, whatever they're interested in, they're allowed to go and experience that firsthand, hands-on, whatever they want to do, it's driven by their passion. And their classes are adapted to what they want. So I think it's just important to let the students know that not everyone's journey is going to look the same. Not everyone's going to go to college right out of high school. Some of them might take the career tech way. Some of them might take a year off and then go to college. I think just fostering that safe and comfortable environment and relationship with them so that they can express it is probably the most important thing right now.
I think from a medical standpoint, when I'm seeing these adolescents and the parents in the room, obviously I'm not at the school with them, but I get the chance to kind of be another supportive figure in terms of an adult that cares about you. So asking, how's school going? What subjects do you like? What do you enjoy doing? Are you doing well? And then that gives them a chance to, usually they just say, yeah, I'm doing well. And then I ask them, well, what does that mean? What do your grades look like? You feel like you're learning. And they get a chance, from coming to see me, they get another adult that cares about them, and then it gives their parents a chance to say, actually they're not doing well in their homework, this and that, and then we get to partner together to find what's going to help them. What do they need at home? What do they need at school? Do we need to send a letter to the school for extra assistance? Do they need referrals for ADHD testing? Do they need things like that? So I don't get to walk with them through the school, but I like to think that it's just another person that gets to support them and show them that they're worth investing in.
Education, collaboration, and definitely interdisciplinary care. I know, and just seeing the person as a whole, like Q was mentioning. I think I work a lot with sensory things. So if a youth is acting out in school, communicating with the teachers, okay, maybe he's having a behavioral reaction to something that's inside of him or a sensory reaction. So educating them on brain breaks or different strategies that they can use in the classroom. And if they don't have time, I go down and sit in the classroom with the youth if I can, and show the teacher, this is a little pocketbook of exercises that coordinate with his sensory preferences. So if you see that he's acting out, let him take a walk in the hallway, do a couple of the exercises, and then we can touch base again. And just really being open to hearing what the teacher has to say and the teacher being open to what I have to say, and just trying to improve that environment for them.
Thank you. I like that all the panelists were talking about the whole child, right? Not just the student within the child. And I like the word Michaela used. What are you learning versus what grades are you getting? That's a very different conversation, isn't it? So thank you. Next question. How can we improve mental health awareness among young people and reduce the stigma that is associated with seeking help? Let's start in the middle, because we've started on the end, so we're going to go in the middle.
All right. I think one of the biggest things, and we probably all know this though, but I think it's worth mentioning, is to open the discussion about it, have the dialogue about it. Especially as therapists, that's something that we can destigmatize within our realm as well and talk about. I know we're pretty open about it where I work. Most of us see therapists ourselves too. So that's a really good place to start. I also think it's something to consider is, it starts with us too. So if there's things that are happening or in our realm and in our office, if there's clients that we don't want to see because of certain stigmas or biases surrounding diagnoses, those are the things that we have to challenge as well. So I think that's something that we can really consider, and like I said, it starts with us. So
I think we need to be aware too of our cultural differences, because right now there's a group of us who are white women. I would assume we're all, and I'm white presenting, I'm half Mexican, you wouldn't know that, but I think that we have to be aware walking into those situations with our clients that they're gonna see us as, we're just different, right? And I think if we're not aware of that, we're already going into the situation not on a good foot. Because I think, I look at it like this, the way that my family talks, my Hispanic side, we don't talk talk like this were more like higher level. And so I would, coming from, like, because I grew up in California, and so when I go home, right, you can hear my entire family from like the yard just talking, and it sounds like we're yelling. And I'm like, I'm surprised nobody's called the police on us, right? Because it sounds like we're yelling at each other, but that's how we talk. And so I think, like, even thinking in that way, like looking at the panel who's on here, we're all, white women. And so knowing that that space also creates some tension too.
I think one thing that helps is just starting the conversation. So when our patients come into my office, they automatically always get screened with either the PHQ-A or the PHQ-9. And then they'll do the GAD if they need based off their symptoms. But what helps is I don't have to necessarily ask them right away, like, how are you feeling? I get to be alerted before I even go into the room that something's off. And it's at the top of my screen in bright red. You can't miss it. So that helps because, especially with the adolescents and the teenager population, they're not usually coming in unless their mom or dad or their guardian's bringing them in saying they're struggling. They look like, they're having anxious symptoms, depressive symptoms, insomnia, things like that. But it gives the child a chance to answer without actually having to say anything to my face. And then I can easily say, hey, I'm a little concerned. Your screening was a little high. Can we talk about what's going on? And then they don't have to bring it up first. So if I gently bring it up saying I'm concerned about you, just because we routinely screen everybody, and that really helps just start the conversation. And usually once you start it, they're a little bit more receptive, not always, especially with the adolescent population, but it's a little bit of easier conversation when you have something like that.
So I have a really unique position where I'm at because I'm with literally the youngest and the smallest learners in our district. And so they originally, when they separated the preschools from all of the other elementary buildings, they did not have a school counselor in the building. At the time, there weren't enough in the district to place one there. And they saw the need early on and very quickly that we needed to start at the lowest level and build up that foundation for their social emotional learning. And so I get to start out and be their first, the children's and the parents' first experience with social emotional learning, with mental health. We work with ComQuest and child and adolescents who come into our building. So they also give that firsthand experience to the parents to be able to collaborate with them and letting them know that it's okay to have these conversations, it's okay to have these emotions and these feelings, but it's what we do with them after. And so we use zones of regulation and a evidence-based program called PAS, which has set curriculum for every day. There's a lesson within the classroom, so it's normalized within everyone. And they talk about ways that they can regulate themselves, coping skills that they can do just within their classroom. And then I get to come in and kind of do a small group with them based on what they've learned in their classroom. So it's really eye-opening to see how many parents are unaware of the mental health services that are out there. So being able to start at the smallest level or their first step into education really has helped set that foundation for them.
Just to jump off of that, I love that you use the zones of regulation. That is my jam. So I work with teenagers and I work with very cool teenagers. So they did not get that growing up. So emotional identification is a foundational skill. So I love hearing that we're integrating it into the schools. That's what we do on my unit. Every morning we have a check-in. We get the guards to check in with the boys and we kind of have a star of the show that morning, and it's their job to check in with everybody. What are you feeling this morning? And we treat it like a code language. So we'll say, I'm feeling blue today. So that not everyone has to know that you're feeling sad. It could be that you're just tired. And then later you can unpack that with your therapist. So I love that the zones are being used on a foundational level so that hopefully in the future, that's just a normal thing that our youth can just say, I'm feeling blue, or they can take it a step further, feeling sad or frustrated. And that's a normal thing, because with me growing up even, I grew up in a higher income school district. We didn't talk about emotions even then in the classroom. So I think just integrating it in every area and normalizing it and then making it cool, letting them have their moment to talk about or facilitating that conversation themselves.
Excellent, thank you. This next question, I think was kind of introduced with Autumn's talk, and so just a follow-up. So with that rise of social isolation and loneliness, particularly exacerbated by recent global events, how can we facilitate meaningful connections among youth?
Sorry, you're hearing my voice a lot now. So I think just investing in our community. I know I volunteer at Gigi's Playhouse, where everyone's welcome. It's a Down Syndrome Achievement Center. But that's a community programming that has a variety of programs. So teens can come. They can help kids that are like them or unlike them if they want to have more of a, professional role because they're young adults. Or you can just go and hang out or just go to decompress. I know LeBron James is opening a community mental health center in Akron, just a few blocks from where I live. He just opened a community center that's going to have a Mitchell's in it, has Starbucks, music plays there. Just investing in our community and making it accessible for our lower income youth or just people in our community in general to make it so they can walk there. I know downtown Akron, a lot of people walk around places. So LeBron has made that accessible. Gigi's is right there, you can organize transportation and just like fostering community wherever we can in our community, because I think we have lost that.
I think we're seeing more of the churches in our community. I know some have been reaching out to our agencies as far as bringing in speakers, again, creating a safe environment where kids can talk, but also bringing the spirituality of whatever it is that they choose to believe along with that, and show them that that can also be a very powerful source for them to turn to in need.
I think if our youth aren't seeing you practice what you preach, then what you say really doesn't matter. And so sometimes in session, I'll be like, hey, I need to really take a break. I have to tap it out. And tap it out for me is EMDR. I don't know if anyone knows about that, but it's eye movement desensitization reprocessing. That's why we call it EMDR. And I'll literally sit in there, I'm like, I just need to tap, and I tap back and forth, because if I'm asking them to do something, why am I not showing them in session and showing them outwards? And I always say, if you see me out and you see me going back and forth like this, it's because I'm overstimulated and I'm just trying to calm myself down. So if you see me out and doing that while I'm talking to you, it's not that I'm not interested. I'm just trying to calm myself. Now, am I being over dramatic? Absolutely. But again, if we're not taking the time to show them, then what we're saying really doesn't matter. And also investing in what's popular right now. Not that we want to, right? I don't care about My Hero Academia, which is an anime, but do I know a little bit about it? Absolutely. Would I rather look at sports and do things like that? 100%. But now I'm kind of anime fan, because if we're not digging into them, then they're not going to feel connected. They know it's just a facade.
Yeah, I love that. I think having them have their own interests is super important, and something that we've all identified is that the social media thing is obviously a problem. And so what can happen though is that they'll be scrolling and scrolling and then maybe not going outside and fostering those connections. And what we know is our brains as humans are literally wired for connection. So we need to continue to push our clients to get into interests, certain hobbies, groups, sports, any activity that they can. And I think this will really help just with the overall loneliness. And then what we know too is that the loneliness then drives the depression symptoms, anxiety symptoms. So I think if we can push them to do some more activities and get into just interests in general, I think it could do really well for them.
I have one more thing to add. So we talk about this window of tolerance, and I know back in the day, my dad would always back in my day, I walked 787 miles to school, and it was snowing, which it doesn't snow in California, where we live. Yeah, and I would always make jokes about it. I'd be like, okay, but what happened is that generation and my generation, we were allowed to do a lot more things outdoors and things like that. But what happened was we experience some trauma, right? When we were doing those things, we were allowed to go out and we were allowed to stay at people's houses. And so what happened is now parents have shifted to, we're kind of making our children's window of tolerance like right here, where ours was like this. And so what we're seeing is, we're like, well, why is this child, they gotta see, why are they suicidal? Yeah, because their window of tolerance is right here. So where you and I could cope with that, they can't cope with that because we've made it like we don't want them to experience this. We don't want what happened to us, let it happen to our kids, which is beautiful and great because that's healing, but it also has reduced our kids' ability to manage and cope.
I just have one quick addition. Since I do represent the nursing field and medicine, I think the word stigma was brought up at some point in some question. I'm not sure if it was this one. But I think it's really important to reduce the stigma for our kids in taking medications. I am probably one of the most conservative prescribers in Stark County for kids. I'm going to go homeopathic and I'm going to send them to therapy before we start any type of medication. I start at ages 5 and I go to geriatric, and some of you are probably thinking, how do you medicate a 5-year-old? Why would you medicate a 5-year-old? Well, believe it or not, I don't have that much time to explain that, but there are some 5-year-olds that really, when you look at their quality of life, it is suffering, and I have seen medications turn that around because these kids get very stigmatized, they get marginalized, they find other marginalized kids, and then we run into trouble. So I think when I have the parent and the child in there, one of my primary roles is to take that stigma when it comes to medications and to educate them how medications can be beneficial, but I always leave the parent in charge. I'm just there. I am the catalyst just to kind of give you my education and my professional recommendation. And again, I'm conservative. These brains are growing, but there really does come a time when I do need to step in and medicate. So it's my job to help reduce that stigma.
I appreciate all the insight and coming from different angles and lenses. I'm going to pretend for a second I'm not a clinical mental health educator or practitioner. I'm going to speak as a parent. My 3 sons all attended and one still attends, a very large urban school district, Akron. And they were out of the classroom for a year online, completely online. Not hybrid, nothing, completely online. And it was very difficult transitioning back after COVID. Particularly when they knew other schools, private or suburban, were back in session. What happened this year is, even at the high school level, they lock up their cell phones in a pouch. And parents talk to parents hopefully talk to kids. Guess what? It hasn't been problematic. I'm not talking necessarily behaviorally. I'm not in the school as an educator, but the kids aren't complaining. They complained a couple of days. Some are complaining. Okay, I'm getting some are. Okay, go ahead.
Some are actually coming in wanting myself to write a letter that they suffer from an anxiety disorder, separation anxiety, and the phone is what they need to be able to call their parent during the midday, and now you're taking that coping skill that my therapist taught me away from me. So I'm sorry, there are the exceptions, but I do agree with you. I mean, we do see, I think Kansas City Schools, McKinley is also doing that, so appreciate your comment.
Yeah. So there's probably lots of layers. So I was just sharing from the students that don't have a particular request or part of their family system or plan, but they're liking the engagement. So they're liking the engagement. Very good. So on to the next question. What we have here is we are saying, are there specific interventions or approaches that strengthen family relationships and create a positive home environment? So some things to think about. And anyone can start. You guys all have such great views.
From the school perspective, we do a lot of family nights, which help bring the families into the building. They can see where their kids are at, what they're doing every day. And then also, I'm sure anyone that's a parent you're probably connected to your school's social media, which they use it not only to promote their school and what they're doing, but they also use it to share with families what is going on inside the classroom, the small things that are happening day to day, and also to help them feel connected with their students. Maybe there are like protocols that the school uses that they can implement in their home, like a home environment, and changing it up so that they're still enforcing the same rules that the schools would enforce. And then also allowing parents to participate in any activity within reason. So at the preschool level, we have lots of parties for holidays. That's like a big thing for them. And so we allow the parents to come in. I know during COVID, it was like a time no one was really allowed in the buildings. And that was really hard for the kids because they didn't feel supported from their school or their families because they felt like they were isolated in their classroom. And so allowing parents to come in and participate in those things has really promoted like a safe sense of community for them.
So one of the questions that we routinely ask, like in our well child visits, is, do you have dinner as a family? And more times than not, the question is no. And I'll ask them, well, what does dinner look like for you? And it'll be like, sometimes it's sports related, we're running around, this and that, we're getting fast food. But a lot of times it's, well, I just make the dinner and then I let them go sit in their room, they can eat it. And we eat at the same time, we just don't eat together. And so then I just try to ask them, well, why? What's the reason? I mean, that's a perfect time that you can sit when you're eating. No phones, put the phones down, you get to talk about your day, the parent gets to talk about their day, the kid gets to talk about theirs, and then everybody equally gets to share, and then really just work on that relationship. It's something so simple for an hour each day, and then from that it can trickle into more. But I think that's just a simple thing that a lot of families don't even think of how important that can be.
Yeah, I love that idea. That's awesome. I think just this concept of overall engagement with the family, something that I see a lot of is just parents that will drop their kid off and leave before session and then pick them up, and we don't really get to interact. And I think something that's really important is the overall engagement with the family members, whether that's the entire family or even just the parents, checking in with how their therapy is going, and then being able to know what we're working on in session, so then at home they can be working on the same things too. And I think that's also helpful, like in the school as well. Things that they're learning at school, they can also take home. So this idea of, having family dinners, having more check-ins, and just overall more engagement.
I do an activity if parents are struggling with expectations of their kids or just kind of just putting a lot or not understanding. I have them do this activity and I have them close their eyes and I say, I want you to pull up an image, a picture of you as a mom or a dad at 5 years old or 3 years old. And so they do it. And I'm like, I want you to have that person, that little girl or little boy, stand in front of you, and I want you to say those things to that little you and put those expectations on that little you. And they usually cry because I love, that's like the goal. I'm like, okay, we got it. And I even tell clients, like, pull that up, pull that image of that younger you up, and I want you to say those things, because chances are when you pull up a younger you and you're like, you're an idiot, you're fat, you need to get A's, you need to do this, all of a sudden it switches a perspective. And I ask people, what does that little you need? And they're like, I just need my mom to hug me. I just need my dad to be present. I just need connection. And it switches, right? It switches their thinking and their parenting style. So then they ask the question, what does my son or daughter need? Not what do I need from them? What do they need from me? And so it switches a perspective. And so a lot of times when we do that, we switch perspectives, the connection increases with their kids, and then it improves behaviors. Imagine that.
Pausing to see if there's anything else. Okay. You're so wise. I love hearing from all of you. Yes, I know. So we're going to ask maybe a couple more of our questions, and then I I don't know if we warned the panelists that we might open it up and let some of you ask them some questions. But if you guys are, I warn you, if you're really silent, I still have another 10 questions I can go through. So don't worry, we will have the time. But I think because we talked about social and emotional well-being quite a bit, how can we involve youth in the development and implementation of strategies for their own social and emotional well-being that are culturally sensitive to you? Oh, sure, I can repeat the question. How can we involve youth in the development and implementation of strategies for their own social and emotional well-being?
I'm a big believer in sports. I always encourage kids to try to find an interest in what they like to do, if there's an activity at school. But I really like sports because I think it promotes teamwork, it supports discipline, it helps with responsibility. You have to be there for your team. It allows them to find a likeness in a group, especially I think someone mentioned those middle school ages are so important. And for them to maybe then find a platform within this group where they have similarities, where they can grow their confidence and feel more confident in themselves and have people who want to back them and start to form those lasting relationships that will take them into high school.
I think a little bit of the answer to the question is in the question, how can we involve them, is to involve them. Sometimes I think we assume just because they're younger that they don't have a good say in what could be helpful to them. So if I have a patient coming in and they're saying, I can't sleep, and I'm asking them, well, what does that look like? Falling asleep, staying asleep, all the questions. But then I ask them, well, what do you think would help you? What do you think is preventing this? Or if they have anxiety. I mean, I have a whole list of things that I could tell them, I think this will help you in this and this and this, and I can go on, and they just stare at me with glazed eyes. But once I ask them, and then it comes up and tells me, well, I can't fall asleep because my thoughts are racing. And I said, okay, well, can I offer a solution? And usually they'll say yes because they don't know how to help that. But I think the biggest thing is just giving them the chance to try to help themselves a little bit with what they think could help, and then I'm walking aside them with some other things that maybe they didn't consider. Giving them a voice, because like I said, a lot of times we don't give them a big enough chance to speak for themselves, and we think that they need to just be told what they could do to help.
I think giving them perceived control over the situation and taking our expert hats off. I always tell my youth, I can't do my job without you. So you guide me and I'll give you the resources. And they've come up with a lot of really creative ideas that have helped them because they're the experts on themselves. So really maintaining that client-centered care. And to touch on the cultural sensitivity, Marissa's right, we're a panel of white women. I know I work with no girls, so I'm not a man, and I work with a very diverse population. So just hearing them and learning from them and not being afraid to learn from them, regardless of their age or their religion or their race or anything, we're lifelong learners if we're practitioners. So just really leaning into that and letting them teach you.
Excellent, thank you. So just a little bit of a change here is, what advice do you have for graduate students, because we know we have quite a few here, on resilience and coping with challenges in their professional paths?
So I don't know if you remember, but Dr. Pete said that I went to Walsh here and I graduated in 2020, and then I went right into PA school, physician assistant school, in 21. So I've been a grad student for, it feels like a long time, and I just graduated. But I think one of the biggest things when I was going through both programs was trying to, pep myself up, like, this is tough, how am I gonna get through this? But one saying that always got me was, the only way out is through. And what that meant to me is, sometimes things are hard. You feel like you're not good enough. You feel like imposter syndrome is something we talked about. It's very real on the other side of graduate school too, as most of you probably know, but really just pushing yourself and reminding yourself why you got into the profession that you got into, why you're in school, what does the outcome look like for you, and reminding yourself that there's people that you're going to help, that you're going to equally gain some experience and perspective from them as well. So if you're in grad school, keep it up. You can do it.
Be picky with your passion and be picky with your employer. If your employer is not supportive of you, I work for a wonderful agency. I do not work in an easy environment, but the agency that I work for has been there with me every step of the way, offering me support, offering me whatever I needed. I check in with my supervisor every week, even if it's just a check-in for me. So if you do not feel supported where you work, don't be afraid to walk away from that and look for something else, because there are employers that want what's best for you, and they want you to be well so that you can help people. So it's your life and it's your career. So be picky with your passions and who you work for.
I definitely agree on the support aspect. Coming from a school counselor, we're generally alone in our buildings. There aren't typically more than one of us, so we don't have the support of, all the teachers in our grade band or all of the teachers on our team. It's just us. And so making sure that you have that support from your upper admin or your supervisors is really important. And I also think just recognizing that you don't have a magic wand. You don't have the answer to everything. Some problems you just can't fix. You can't change what their environment looks like outside of them being with you. So it's important to just support them along the way. And a lot of people will come to you wanting you to give them a magic fix to the problems that are maybe going on in their classroom. And it's just important to take a pause and really think about what behaviors or what emotions that kid is going through, and really focusing on the student instead of the emotions of sometimes the adults that are in that room. I think just you're not going to have the answer for everyone, and not everyone's going to want to hear what you have to say. So just knowing that you're doing what is best for that student or that client is what's really important.
You need to work on yourself, because you are going to go into a profession that's asking a lot from you, and chances are when you do go into whether it's OT, PT, counseling session, you're going to be faced with your own trauma. And so if you haven't worked on it, it's going to kick you in the teeth and then push you in the mud and then throw sand over you. And so if you're not working on yourself, and if you haven't worked on yourself, I would encourage you to find a really good therapist, because there's a lot of therapists. There's not really good therapists that's trauma-informed, that does trauma work, and that can do things to help your brain so that when you do go into those situations, that you can tell yourself, I'm safe, I'm okay, and I've got this. So yeah.
Being in this field now for close to 27 years, I'm towards the end of that journey as far as my career goes, even though I will always stay active in it. But I think the best advice that I can give you is boundaries. And I know that you've all studied boundaries, but they're so important. Because as we all know, whether you're an NP, a PEA, an OT, an LPC, this field in general, we hear some of the most heartbreaking stories. And every day we go home, or at least I go home, I can only speak for myself, and thank God for what I have, and the children that I had. And I just can't emphasize enough to set those boundaries, take care of yourself, don't internalize everything that you hear, know your own trauma. I think the last statistic out of OSU was 68% of people who go into the field of mental health have suffered some type of mental illness themselves, which is pretty high. So yes, resolve your trauma, because you'll be triggered, and you want to be the best therapeutic voice that you can for your patient. Have that balance in life, do self-care, but most importantly, always be genuine to yourself. know who you are, because that's the only way that you'll ever be helpful to someone else. If you don't know what they're going through, you don't know what they're going through, and I don't know what you're going through. Don't assume anything. Probably the biggest mistake I made as a new grad. Don't assume anything in psychiatry, because you have no idea, and nor do they. You know, transference, countertransference, we all know those words. Be very aware of that, but most of all, know your boundaries, because that is what will protect you. And I love the fact that someone said, we're not going to fix everyone. You have to focus on, I always tell myself, if I just helped one person today, I had to be satisfied with that. And I can see 21 patients in a day. But I think, you're not going to fix everyone. And not everyone wants to be fixed. So when you find yourself working harder than that patient to help themselves, then you've got a boundary issue. So I could go on and on. I'm sorry, 27 years is a while. But I wish everyone who's a new graduate the best of luck in your career. And we need you. There's a lot of people falling out of psychiatry, especially in the medical field. Our average psychiatrist right now is in their 60s, and they're falling out. So any nurses out there or PA students, are you all no nurses? Okay. Well, yay nursing. Well, I love all of you. I love my counselors and therapists. You're very helpful.
Okay, so we are going to open it up for some questions. If you have a question, raise your hand. I think Tiffany will be on the microphone running, so. And then it might be
Hi, my name's Casey. I work in pediatrics, and I've noticed this year we have a lot of little friends that are kindergarten level, first grade level, that are coming in with a lot of trauma. What would be your first steps on helping the staff and begin helping the student with that trauma that's coming in? Because I find whenever we get these students coming in, there's a lot of behaviors, there's a lot going on, and it's very overwhelming, and I think people struggle with the first steps. What's the first thing to do helping the students?
Thank you for your question. Okay, number one, I think it would be good to encourage parents to try to get their kids into therapy. I see a lot of parents walking in with the Vanderbilts, and the teacher says they need medication. If they don't get medication, they can't come back to the classroom. When clearly is not ADHD, it is trauma, it is anxiety. So as somebody in the classroom working with the parents, when referring to professionals, I would encourage you always to, especially at that age, therapy first, trauma therapy, whatever. But because then the parents come in, they have an expectation that I've got a magic pill. I've got a magic pill for my kid's behavior. He won't sit still. He's not focusing. He's throwing desks. He's throwing papers. He's running out of the classroom. Oh, well, that's ADHD. No. ADHD and anxiety, those symptoms really parallel each other. And that's why we're getting an overdiagnosis of ADHD. These kids are getting on stimulants at a very young age. There's side effects that come with stimulants. So again, thank you for your question. I would advise therapy, any type of therapy.
I think it's important to note that students that are going into preschool, kindergarten, first grade, they've never experienced life without COVID. So they've never experienced a world that was not the way that our world looks right now. And so, yeah, they do have a lot of trauma, and they have experienced things that we never experienced when we were little. And so letting them feel those feelings is really important. But also guiding them to doing it in a safe way. So I work with a lot of kids who have very high behaviors and high behavior needs, and the most important thing that I've learned through the whole process of working with them is that they have to be able to feel it, and they have to be able to express themselves, but doing it in a safe way is the way that we can help. So their feelings are their feelings. We don't know why they're feeling that way, but we can help them kind of shift their behavior from a negative into a positive. So just making sure they're in a safe environment almost like coaching them through what they're doing. And so if a kid is kicking the wall, sometimes I'll typically say, what you're showing me is that you're really angry. I know that because you're kicking the wall, you're throwing things at me, you're using a loud voice, your face makes me seem like you're angry. And then usually they're able to then identify, okay, when I'm angry, I kick the wall, I like to throw things, and usually my face is red and hot. And so then they can start working through those things, but letting them feel those feelings can really help.
And just to segue onto that, a lot of times these kids don't know what those feelings are. You know, anger is your secondary emotion. There's something underlying that. They don't know anxiety. They don't necessarily know frustration. They don't know depression. They don't know embarrassment, things that are making them act out. So this is how they're showing that they're not okay. So as you said, it's important to get them in, figure out, you know, okay, this is what you do when you're angry, but then to try to peel that level back one more and find out what is that emotion that's driving that anger that they just don't know how to explain.
Do we have any others? Any other questions? Am I missing anyone?
Oh, up here.
Not very observant, sorry. I'm getting kind of mesmerized by all this wisdom up on stage here.
Sorry. So I was wondering if you could speak a little bit to the difficulty of dealing with a child who's sitting in front of you for maybe 53 minutes once a week on a good week. And then you're sending them back home to an environment that's not conducive to their healing, and then dealing with parents who are also, you know, overwhelmed and struggling and have a limited capacity of understanding on their own.
Thank you.
So in order to have success, in my opinion, in session when you have situations like that, getting the parent to understand what's happening. And so I use lots of visuals because even if you're illiterate, even if you understand pictures, right? You can kind of connect it and tap into that part of our brain. And so if we can make it pictures, if we can connect it to, there's this analogy I use, like we're the car. And so we need some support. So you're not gonna put the tire in the motor and expect the car to go and put the motor on the right side where the tire goes, right? So we need help. And sometimes we have people that are just, in that position to help financially or whatever the case may be. But if we're using different types of analogies and pictures to give them a visual to connect to that part of the brain, I've seen that make a lot of a difference. I don't know if that's the right way to say it, but I've seen a change, but also bringing in the parents in there and teaching them as well has been helpful. I use this, what has really helped with some of my kids, one in particular is using it in a third person. And when you use a third person, like, what do you think a kid your age would need? Or what do you think a parent your age needs? And this kid can list all the things that should happen and all the things that a parent should do, because it's switching it from a third party. So it's just being aware, or third person. It's being aware of what our kids and our parents need and tapping into that.
Other questions? Or other replies? Very good.
Hi, thank you all for being here today. We've talked a lot about, trauma-informed care, evidence-based practice, all of these really great things. But what are some of maybe the barriers to treatment that you all see in your practices, in your respective roles? If maybe a young adult isn't ready to get help or doesn't even recognize that need for help, how do you all respond to that?
Great question.
Yeah, just meeting the youth where they're at. If they're not ready to change, that's their decision, and respecting that. I think, at least in my profession, I work with a lot of different therapists and teachers and things, and we want our youth to wake up tomorrow and be a respective member of society. They have a different lived experience than we all have different lived experiences that I wouldn't be able to understand what you've gone through, and that's what makes our brains so special, because we have different pathways that lead to different reactions and different actions, whatever. And I really emphasize that with my youth. You might not be ready today, and that's okay, but what are you ready for? And opening up that dialogue with them and letting them choose. If they just want to play Jenga today or just listen to a song today, they came in, and allowing that. And I think that that helps foster that safe space where if I'm not ready to dive deep into everything and change tomorrow, that's okay. Because true neuroplasticity, you need to practice, practice, practice to learn that new paved road. And that's how I see it.
So I think this kind of answers your question and the other question. When there are parents that don't want to identify their kids as having high needs or high behaviors, or identify that there could be some underlying mental health and trauma there, I just make sure I provide them with as many resources as I can. And at the end of the day, I'll know that I gave them as much as I could. And when they're ready, they will have that information to use. And also just meeting the kids where they're at, I think is a really big thing. They might not want to talk about it, and they might not ever be ready to talk about it, but just knowing that you're there and you're a safe environment will really help them.
I think from my standpoint, there's a couple barriers for me because I don't get the luxury of long time with my patients. I get maybe 20 minutes if I'm lucky. So one of my biggest barriers is when I have kids that are expressing some mental health concerns and the parent's not on board with getting help. When I offer, hey, we have all these services, we're really lucky. We have psychiatrists that work with us, counselors. I can sometimes get them in the room right after I'm done, and the parent will say, no, they're fine. They don't need help. And it's really hard to get the teen on board when the parent doesn't think that they need help. So then we're kind of at this standstill until I can, have them come back in a couple weeks. I try to keep close follow-ups with those kids just to see how they're struggling. But then if the parent doesn't bring them back, they're not in full control. So that's tricky. And then a lot of times those parents want me to diagnose them medically. They don't want to accept that some of their problems, their sleeping problems, their problems in school, they're feeling really tired all the time. It's not always medical. I mean, I can run all the labs, I can give you certain medications potentially, but a lot of times the blood work comes back normal and then you have to sit and have that conversation again. I think this is something to do with your mental health. And that's really hard to get the parents on board with that because they just, like we all have said here, they just want an easy fix sometimes. So that's one of my biggest barriers.
Anything else? Okay. I'm double checking. Oh, we have, okay.
All right, I get to ask a question, which is cool. I don't know how to ask it, but it's just in my head. Do you guys feel like there is enough wraparound services of all of us being able to come alongside the clients, or do you guys feel like you're on an island?
I really think that Stark County does well as far as wraparound services. There's actually so many out there that I'm not even aware of, so I always appreciate when I can collaborate or somebody approaches me and say, hey, we offer this service. But I would have to say throughout the years that I've been in this field, I think right now we have more awareness and collaboration. There used to be a lot of turf wars, whether it was between nurse practitioners and counselors or, for whatever crazy reason that was, back in the day. I think we're all collaborating quite well together and we all appreciate our own areas of expertise, but I think there are a lot more community wraparound services available now than when I first started out in this field, which was in the mid-90s.
It would benefit every agency to have a social worker. I would always tell my previous agency, everybody needs a social worker. We're a jack of all trades and a master of absolutely none. A caseworker. A caseworker can get you out of a pinch anytime and help you go into schools, advocate, all that stuff. And I think having the role that I do, I advocate for my clients in the schools as well. So I'll call the school with a release of information. But I'll call the school or email them and say, hey, I really think this person, this kid needs to be on a 504 plan. This is why, this is what I'm seeing. But also making myself aware of like, what are the key words that they need to hear in order to activate a 504 plan and activate an IEP. But also on the flip side, advocating, like empowering my parents to also know, like, if they don't do what they're supposed to, you get permission to go to the state. You can advocate for yourself in that way. And so, which a lot of times my teachers are like, ugh, or my admins are like, oh, why are you saying that? It's because if we don't give them the resources and know the resources ourselves, then how can I provide that for my client? And so letting them know what's in the area. And if you don't know, there's a help guide in the area that will give all the resources that Children's Services in Stark County has. You can talk to like public health of Stark County workers, NAMI, 311. I think it's either 311 or 411 was for information before, back in the day. So yeah, educate yourself.
I was like,
So as an OT, I think it's difficult to explain occupational therapy in a traditional sense, let alone in the mental health community, regardless of the fact that we were kind of born in the mental health community or in the setting, but we're growing our roots back. But to answer your question, sometimes I do feel like I'm on an island. I don't think that there's enough education in our field maybe, and how to explain what we can do in mental health, and maybe in other fields, like my friends are doctors and they're like, oh, we got one slide in a lecture one time about what occupational therapy is, and that's for medical doctors. So you can imagine maybe what what we're learning about, in mental health regarding OT. But with my experience in the setting, all of my lovely social workers and LPCs that I work with, they're like, wow, like we need so many more OTs, because the counselor or the social worker might tell the youth, maybe you can try deep breathing. Then it's my job to make sure that they are practicing that and they're generalizing that and they know when to use it. So just all my friends, if you want to advocate for OTs to be hired, it would be lovely, because I think that we can improve the wraparound services and work really well as a team.
Yeah, going off of that, actually, working alongside OTs has been a really awesome experience. Being able to have like what we do together in the session, but then also have the hands-on with the OTs outside of session has really made it awesome. And I think the biggest thing to not feel like you are on that island is that communication with the other providers, but that's also a challenge. It can be really difficult because it requires a lot of extra communication that we don't sometimes put aside for. So I think making that extra effort, taking the time to schedule those meetings, have those consultation hours with your care team or whoever is working with your client too, is going to be essential.
So I feel like a little bit of both. I personally know that I have people out there that I can reach out to help with other services. But I graduated in 2021, and so there were only 2 of us in our graduating class that were school counselors. The rest were clinical mental health. So we did feel like we were on an island because it was only the 2 of us. And when you think about in a school setting, like I said earlier, there's typically only one school counselor in the building. And so you don't have that immediate collaboration with somebody. Generally, you have to reach out and you have to find your own collaboration. And it wasn't until I was actually a part of the COPE grant and this past school year that I realized how closely occupational therapy and counselors work together. And so that's like really opened my eyes to a completely different world and way more opportunities for me to advocate for my students. But at times you can feel like you're on an island, but that's why it's important to network, get out there, and just communicate with other people, asking questions when you're not sure.
So thank you. Well, first and foremost, let's give a hand to these panelists for being so engaging. So very engaging and passionate and wise, all those things we appreciate. And I promise you, Michelle and I did not plant Q's question, right, Q? Nor did we plant Kara to say what she said. One of the umbrella goals of the COPE grant is interprofessional collaboration. And to make all these individuals, whether they're students, supervisors, community members, to work together. Because if you look around this room, we're not on an island. We are all very, very much engaged in helping with mental health, social wellness. And one of the things I want to articulate, and Michelle and I were whispering up here, is in this room, we have a number of individuals that either graduated from the COPE program, so that means that they were heavily invested in learning more. And not only just learning more about behavioral health, but learning more about working together on behavioral health goals. So we have graduates from that program here. We have some supervisors of COPE recipients, and we have some current COPE recipients. So if those individuals that have been involved with this great effort would stand up, so we can give you a round of applause for all your extra hard work on making interprofessional collaboration possible, I would greatly appreciate it. I know, standing up at these things is painful, I know. But, so thank you. You should feel very proud of your efforts to kind of get people off their island. And I don't know what Michelle would like to add.
I don't actually have anything to add except for it is a fantastic time to take a break. So we are going to come back right at 11 o'clock to have our final speaker for the day. So go ahead, and still plenty of snacks, plenty of information over there, and bathrooms behind us.
Thank you. Awesome,
That was like-
awesome. Thank you, awesome, awesome. And I love that you were representing. That you used those words. I would never use those because I think we're close. I'm thinking like, we own it.
You did so well earlier. This one took a little longer. Everybody's getting tired, I think. Okay, so thank you all for your attention. So I have Cyrus here. He overcame adversity to become an acclaimed depression and suicide prevention expert who has raised over $6 million for nonprofit organizations. He was the youngest recipient of the United Way's Emerging Philanthropy Award and the Damon Mumford Humanitarian Award. Cyrus owns an award-winning mental health cafe called Greatness Cafe. It's in downtown Massillon, by the way, providing a safe space for individuals to find support and nourishment for their minds and souls. Thank you, Cyrus.
Thank you. How's everybody doing? We could do a little bit better. How's everybody doing? I remember coming to these so often when I was younger. Today, I wanted to go through my story, but I didn't want to pull any punches. I know we all out here work with people, work with kids, and I was that kid that needed the work. So I hope you don't mind me being brutally honest, because I travel the world now doing this speaking, but this is the first time I get a chance to make references to what you guys know. When I'm in Los Angeles, they don't know Canton, they don't know Massillon, but I'm here now, so thank you. No little clap to get me started. I was in the living room with my brother, and we was playing playing Mario, and then boom, 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 I get a knock on the door. I go see who it is. So I get up and I go look, and it's my uncle's best friend. You know, somebody that has bought me candy on my birthday. Somebody got me, picked me up, gave me money, all those type of things. And he's like, is your uncle there? I'm like, yeah, he's right here on the couch. Boom, they kick in the door. They put a gun to my head, my brother's head, and I got a chance to see them jump my uncle in front of me. I didn't know, because they sitting there hiding behind, like, let's just say this is the door, and they're all hiding behind. So when they come in and they're doing this, I thought it was always that separation between you don't touch kids and you don't touch women. That's not the truth. If he's doing something, it affects everybody around us. And I started understanding this even at this young age, because I'm helpless. And I'm like, why would you pull a gun on a kid? Like, what in the world can I do at this moment? And then seeing my uncle struggle, you feel defenseless. But and during that time, I'm looking at my brother, and he's tall, he's 13, and they're really looking at him like, you bet not move. You bet not even think about moving. So we're sitting there terrified, and I don't know how to console my uncle. He's sitting there now bleeding. I'm like, let me just go get some tissue. Let me go get something. I don't know. So after I leave this environment, my mother gets out of prison. My mother was in prison for fraud. As I said, I hope y'all don't mind me being as honest. I guess not. So my mother gets out for fraud, and now I'm going to live with her. So I'm staying out on Lincoln Way. I can't remember the name of it, but it's a car shop. It's literally, they sell cars, and we stayed upstairs. And then staying upstairs, we didn't have at this time no electric and no heat, no none of this stuff. So I'm going to, anybody heard of Genoa and Redurbin? So I'm going to these I'm going to this elementary, my 3rd grade year. And going there, I'm the only black person there. So when I go in, they don't even have a protocol for getting called any term. So you get called the N-word, they didn't have anything to do for that. So, and then I'm going to school lunch, and then I'm on free lunch, and there's not too many more people on free lunch, and I got to whisper my number. And if the clerk don't hear you, you got to say it louder with the line behind you, and you're going through that embarrassment. But in staying at that house, I told you, staying at that house, I remember processing time. Like, I know it's not always going to be like this. So I used to be like, man, let me figure out how my day is going to go before the sun drop. So we would stop at the library, and I would get books on Bruce Lee, get books on dinosaurs, get books on absolutely everything. And that became my regimen for the summer. Let me make sure I read. Let me make sure I do something. I'm throwing kicks. I'm doing pull-ups. I'm doing push-ups, because all I had at this point is a mattress on the ground. and I couldn't go across Lincoln. Imagine a third grader. I'm going across Lincoln Way to call my father. So call my father to bring some food. But if my mom found out at that time, then I would get a whooping for it. So she like, don't call your dad. But really the base of that is my mother, or my father, cheated on his woman to create me in the first place. So that was that disconnect. So my mom is bitter, like, do not talk to your dad about anything. I don't care what it is, do not call him. So what can you do when you hungry? I didn't have no choice. I'm like, I'll take the whooping. I don't care, I'll take it. So one day my mother comes in and she's like, get your stuff, we about to head out. So you third, you just pack your books. That's all I got, I don't got much. So we riding in this car, next thing you know, we pulling up to this big building. And I'm like, what are we walking into? So I walk in and this police officer is like, sit down, just sit down over here. I'm like, okay. I didn't know this was a custody hearing. I'm like, so now I'm just stuck. Luckily, when the people came out, it was my father. So I'm now going to stay with my father at his house, which is a complete 180. My mother was a drug user. My father is a drug seller. So I went from no electric, no gas, none of these things, to now Benzes, fur coats, jewelry, as a flip. But at this same time, I'm in a house where the woman despises me because now I look exactly like my father. So now she has to raise the little boy that was created by cheating on her. You follow me? So with that being said, became a lot of resentment, a lot of under the table remarks, because I got a brother, and I'm gonna tell it all. I got a brother that's 1 month apart. So now we're like what they call that hood twins. When you got a brother that's 1 month apart, y'all like twins, but y'all not twins at the same time, two different moms. So now I'm living in that household with that. So she would do things like make food and it only go to him. And then now I don't got anything. So I would call my dad, and then now my dad is bringing home McDonald's. So now you know what that looked like for a kid, that I'm getting McDonald's and he's not. So it created that little rift at the same time. But as I got older, I started understanding who I was dealing with. I can tell by the sound that she was making in the kitchen on if I should go downstairs. You can tell by the dishwashing. You can tell by what music is playing. If it's gospel music, if it's whatever music is being playing, do not go in that kitchen. Forget it, just skip it. That's what it became. But I started navigating how to deal with personalities dealing with her. I was like, okay, I don't say these words, tiptoe around this, just start asking my dad. That's what it became. It became, how do I strategically reposition myself with this woman? So I started going to the Boys and Girls Club, and that's really where a whole lot changed. Because when I was going to the Boys and Girls Club, that's when I started doing the work that we all do now. At 13, I had to take care of my younger brother. And in taking care of my younger brother, he was created. Me and him got the same mom, same dad. So you can guess my dad cheated again to create him. So, and didn't claim him because of how he would look in church. He got Benzes, he got fur coats, he got all these different types of things. Who's going to claim this son and make you look bad? So now I became the person that had to raise my younger brother. But going to the Boys and Girls Club, they would all divide us all up. So you got the older groups that's going here, you got the younger groups that's going here. So I was trying to figure out ways to spend time with my little brother. And in doing so, I created this reading program. And I didn't know it was an actual program, but it was just getting my peers to read to kindergartners and first graders. So in doing so, I got a chance to hear about molestation. I got a chance to hear about abuse. I got a chance to hear about starvation. I got a chance to hear about all this stuff going on at the Boys and Girls Club, all these young kids. And I was like, abuse? I thought it was just me that was going through this. I didn't know it was more than one. I thought it was just me, so I was keeping it to myself. And I remember not being able to rationalize why it wasn't all fixed Monday. So if a kid told me Friday that they dealt with some molestation or anything, I didn't understand why I would see them again Monday. So I'm thinking, why isn't this just magically going away? Why are they still back here? No matter what it was, why is it an abuse? Why is they still back here? So I created more ideas. I was like, you know what I can do? How can I get them out of the household? So it became, okay, let me have an Easter egg hunt. It had nothing to do with really Easter. It just had, the whole idea was, how do I get people out of the house? So it was an Easter egg hunt. Then I ended up having backpack giveaways. Then I had turkey drives, coat drives, all those type of things, 13, 14, 15, 16. And it made me look like this individual in the community, but I didn't process it like that. That was not my process. So taking care of my younger brother, it taught me a couple of things. One time I went to my grandma's house, which he was staying, which is the same house that was the gun in the first place. So now he's there. So I remember going into the closet and seeing a pair of pants and a shirt. I mean, next to nothing. Nothing. Meanwhile, I got on Jordans, I got on leather, I got everything, and we got the same mom and the same dad. So I'm like, you know what? I can't let this happen. So I remember selling all my stuff. I sold everything that I had at that time, and jumped on a SARTA and ended up going to Marshall's, Burlington at the time, really Burlington. And I remember getting one of everything. I got one black shirt, one pair of pants, and I just got him everything that I got myself. And then I got some of those, y'all remember them rubber duck boots, like $20? So I got him a pair, I got me a pair. And if you feel that you're confident, then you can make anything look stylish. But I felt like if he was going to go to school and get joked on, at least he can have the confidence in knowing his brother is wearing the exact same things. So that was my whole idea behind it. But it was another thing that had happened, because I had one of the worst attitudes of all time. I mean, my attitude was absolutely horrible. I would already process the furthest extent of anything, because I've already seen the guns, I already seen the violence, I already seen the abuse, I already seen all that. So it was no value. I didn't care about the physical confrontation. I didn't care about the abuse. I didn't care about those type of things. So my attitude was horrible, and I didn't know where it came from. Really, it came from later on in life. I figured out it was the fact that I felt like nobody loved me, but I got to the bottom of that. But anyways, I had my brother. I ended up leaving school to go to his parent-teacher conference. And I remember sitting down, and they were like, well, your young brother, he's acting up. He has a bad attitude. He's not listening. He's boom, 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 boom. And I remember looking at him like, almost with disgust, like, you got to act better. You got to do this. You got to do that. They were describing me. They were describing me the whole time. And here I am talking to him about how he need to improve himself. I was like, I am a hypocrite. How in the world am I going to try and help somebody or tell them that they need to be better when I'm doing the exact same thing? And he's just following me. He don't know. His guidance is me. So how can I get mad at his behavior? So from there, I was like, you know what? I got to tighten up, because he's actually watching me. He's not necessarily listening. And I didn't know that. I didn't know kids more or less follow what you do more than what you say. I had to be involved. So I end up saying, you know what, from here on out, I got to change that. I'm going to get my grades in order, everything. So I end up getting a 4.0. Then I end up talking to him about it. Then he changed his grades. And that started becoming a base of my understanding of how what I do affects everybody that follows me. That goes back to the gun. It goes back to everything that I do start affecting what's around me. So from there, after having all these events, turkey drives, all that, I'm going off to college. And I'm getting to college, and I'm like, what am I going to do? I started throwing shows. If y'all heard of like MGK or Kid Cudi or Big Sean and all them, I was throwing the tours, and then using that money to give back to the community. So there's a process, because think about music or whatnot, there's always an upcoming artist and they always want to sell tickets. They always got that. So I was using that to say, this is a way that we can unify and give back to the community. So we had the turkey drives, we had those, but I didn't know that people are watching. So that's how I got pulled aside and ended up winning this Damon Mumford Humanitarian Award. And when I won that, I was like, you know what? I'm going to take this to the Boys and Girls Club. I'm about to show everybody, this is what we can do. I come from this. And as I show up to the Boys and Girls Club, they had the Independent come out, repository, and they taking all these photos of me in front of the Boys and Girls Club. And I remember my dad showing up, and he's trying to direct the photographer on what he should do with the photos. So my dad is like, no, you need to stay in here. You need to do this. And I'm like, Dad, get out the way. Like, this is not what you do. And it hit me. I was like, I'm here for passing out turkeys, coat drives, Thanksgiving, all these different things to the same family that my dad is selling crack to. I said, whoo, this is a deep one. So now the same person that's directing me or directing the photographer is the same battle I'm fighting in the community to stop what's going on. I was like, wait a minute. Everything that I'm doing is always this component of building and destroying. No matter how much I build, it's this destruction that's going on. So like from here on out, I want to build, but I don't want to destroy. How can I build but not destroy? So as I finished up college, I decided I'm going to go down to Atlanta. I moved down there with some friends, and I started throwing more shows because down there it got more opportunities with music. So I'm throwing all these shows, and this is my way of making money. And one time I'm sitting as you guys are sitting right now in these acts, and I'm sitting there listening to the music, and I'm hearing what I'm listening to. It was kill, it was murder, it was what we doing to women in our community. It was all this, and I'm like, I don't know. It's like I never heard the music before, and I'm sitting there like, I'm giving this a platform. This is what I'm aiding. Oh man, this is the building and destroying again. So what am I about to do when this is my livelihood? This is how I'm living down here in Atlanta. I don't have a job. The only job I've ever had was the Boys and Girls Club. And I don't want to transition. So I'm thinking, what am I about to do? So I decided, I'm like, you know what? I decided I'm only going to build, not destroy. So I got to get this up. But I don't know what I'm going to do. I have no idea. And at that point, I started falling into this depressive state. I started falling into a suicidal state. I started falling because I felt like I don't have no direction. I don't know what I'm going to do. I just know I'm not going to destroy. I don't know what the building looks like. I just know what the destruction looks like. So I read every book you can think of. I read every book that people say you can find yourself within. The Bible, the Quran. I read on Siddhartha, becoming Buddha. I read every last one, Think and Grow Rich. You know how you got that whole list of those books that everybody say you should find yourself within. Yeah, I read all them, and guess who wasn't in there? Cyrus. I was not in any of the books. No matter how much I was looking, no matter how much I was searching, I was not in any of them. I couldn't find me within it. So I said, you know what I'm about to do? I'm going on this mission, similar to a suicide mission to some degree. It was like, I'm about to take off. I'm going to Los Angeles. I don't know what's going to come from it, but I'm gone. And I called my journey a full trunk in faith. I ended up giving up everything that I've acquired through shows and anything that was destructive. I gave up everything. And I decided, you know what, I'm taking off to Los Angeles. The only reason I picked Los Angeles and not New York is frankly because it was warm. And I knew I was going to sleep in my car. That was it. So I'm getting ready. I just made this decision on Sunday. Think about this. Friday, I was like, you know what, I'm taking off. By Sunday, I had already given everything away. Tuesday, I left. That's how quick it was. So now I'm taking off to Los Angeles. I've never been there. I don't know a soul there, know anything. So as I'm getting in my car and taking off, I'm going to my first destination. I'm going to Dallas. As I get to Dallas, by the way, I left with $88, not even enough to make it. And I called the journey a full trunk in faith. So I left with $88, and my first stop was that Dallas. And on my way there, I get a call from my younger brother, the one that I was taking care of, the one that I bought the clothes. And he like, what are you doing? I'm like, I'm on my way to Los Angeles. He like, why ain't you tell anybody? I'm like, I didn't tell anybody because we all know the people that got the best advice is those who have never done it. And that's what it would have been. You should do this. You should do that. You should. And the last thing I want to hear is that when I know what state of mind I'm in, I know I don't care. I got to go. So I'm like, he like, do you need anything? I'm like, yeah, actually, I need some money. He's shocked. He like, wait a minute, you always took care of me. You was the one that always had money. What do you mean? So he ended up sending me $125 or something like that. So from there, I go to the next stop. I go to El Paso. So I'm in El Paso, and I'm there with a friend that I went to Cleveland State with. So we play basketball, caught up, and I'm telling him this whole rundown on how I'm changing my life, how I'm building and not destroying. And he like, do you need anything? I'm like, no, I'm good. We sat in that car, he prayed with me, and then he ended up giving me $800. And I said, I'll let you know this, I can't give it back. He like, don't even worry about it. So I go to the next place, I'm going to Phoenix. So now I go to Phoenix, I'm staying there with a childhood friend, staying there with family. And as I'm getting ready to leave, my aunt there says, I want you to stay an extra day. So I was like, okay, I mean, I don't have nowhere else to go. I get up that morning, and I have a flat tire. And I was like, oh my, thank God. I would have been in the middle of the desert with a flat tire. And foolish me, I took it out to put the clothes and things like that, the spare. I took it out to put the things in it that I thought I needed. So I'm like, thank God. So I get a chance to now roll down to the Just Tires. It's a local Just Tires, making sure my rims didn't bend and stuff like that. I get there, I'm talking to the guy. The guy is from Akron. He ended up giving me a tire for free. So I was like, this is crazy. This is like crazy. It's like those little affirming things that let you know you're moving in the right direction. So as I'm driving from there now, I'm going into Los Angeles. I get a call from my oldest brother, the one that I was in the living room with. He's now out of prison for manslaughter. Like I said, I'm not pulling nothing back. He's out for that. And he calls me and he's like, I got somewhere you can stay. Because I didn't know where I was going to stay. My GPS literally just said, Los Angeles. That's it, Los Angeles. I was like, I don't know where I'm going to stay, but I'll figure it out. So as I'm driving there, he's like, well, I got some place you can stay. I'm like, okay, give me the number. He gave me the number of that contact. I called him. Yeah, I never talked to that person. And I remember telling my brother, I can do bad without help. You don't have to, do any of that. So now that I'm getting to Los Angeles, I'm parked in Santa Monica. If anybody been out to LA, where Muscle Beach is, I'm parked in Santa Monica. And I remember watching the sun drop. And I was like, now what am I about to do? I'm 2,300 miles away from my support. I don't have no money, really. I got about $600-700. And I don't even know where to go. So I got this idea of going to park at the hospital. So I figured if I parked at the hospital, people would think that I was waiting on somebody there. So that's where I end up sleeping. I'm from going there, going back to the beach, going there, going back to the beach. And luckily, the Children's Hospital out there in Los Angeles is a heated parking lot because I thought for some odd reason Los Angeles don't get cold. Foolish. So now that I'm going back and forth, I end up running into a guy that I met on an all-star team here in Massillon. And they end up trying to make the story shorter. But I end up staying at his place for about a month. But at this time, at least I know Los Angeles a little bit better. And I end up getting this job at LA Fitness. And at LA Fitness, it gave me the ability to bounce around to every single one. So I went to every last one from here to, let's just say, Columbus, because I was on this journey to know Los Angeles like the back of my hand. And I went back to being homeless now. But at least I know where I can park. I know the areas. I know where the gang territories is. I know where you got to stay close to where a 24-hour bathroom is. I'm learning the whole specs. And during that time, as I'm going to these different LA Fitnesses, it was one that was my favorite, and it was in Marina Del Rey. And that's like where the beach is. It's a really nice one. And as I'm staying there, this guy that I built a friendship with came up to me, and he's like, you know what, I really like your personality. I like, who you are. He was like, I got a job for you. I'm like, what's the job? He was like, I want you to help distribute this new liquor rollout to the black and brown community. I'm like, $65 an hour. I'm like, $65 an hour. I remember thinking about it. And I remember getting mad at myself that I even had the thought to take it, because I still never had a drop of alcohol, never had any weed, no drugs, no nothing. But here I am still, I'm contemplating taking this job because I'm homeless. And I was like, I can't take it. I can't. Because I would have felt like that same person, that hypocrite about that building and the destroying that I talked about earlier. But now I'm thinking, what can I do? Now that I know Los Angeles a little bit, I said, how about I get back to my community roots? So I was like, I'm about to go speak at every school. I don't even know my message yet. So I'm like, let me go speak at every school. Then I started waking up in the morning and going to the Panera Bread. And I'll say, you know what, I'm going to sit down and I'm not going to get up until I write a chapter of a book. That's it. So I'm writing, speaking, writing, speaking, writing, speaking. As I kept speaking at schools, I started finding out my message. I got a chance to go back to those one-on-one sessions that I was having at the Boys and Girls Club. But now I started hearing about a cultural difference. I started finding out that we can look at the gangs, but we may not know that a kid been bounced around 17 times. And then when they got 18, you got to go. Here go $200. So who are they embraced by? Some gangs will pull them in. So on the outside looking in, we just think we looking at gangbanging, but we didn't know that this person was in 17 different homes. We didn't know he never had an education. We didn't know any of these type of things. We just looking on the outside. And then as I'm going to these schools, I started hearing the same things I heard then. I'm like, wait a minute. All this is connected. It's just different cultures. It's just the way we look at it. And even when I'm sitting in this parking lot and where I'm sleeping at, I remember seeing all the homeless people in front of me, and I didn't know there's a hierarchy in homelessness. There's a difference between the homeless people that got kicked out of a home and can't find it. It's a difference between somebody out there on drugs. There's a hierarchy in this. And you get treated differently based upon the type of homeless you are. That blew my mind. I started understanding the closer you stand next to the fire, the warmer you get, the more information you acquire. So as I'm out there, I'll give you a small example. When I'm out there in Los Angeles, they was trying to figure out what to do with the homelessness because they had all them peeing and pooping on the streets and whatnot, so they try and relocate them. And if you don't know, being next to a sewer is prime real estate because not only do it blow up warm air, you got somewhere to dump your stuff. So that's an area that homeless will actually fight over. Let me be next to the sewer. So anyways, Los Angeles thought, let's put some porta potties out close to the homeless, so now at least they can use the bathroom, they can do all these different things. And that sounds like a great idea. Let's put some porta potties out. But what happened is the quote-unquote high-level homeless people started bullying the porta potties. Like now you got to pay $1 to use it. Now they moving the porta potties closer to their home area, they tent. That's what started happening. I was like, wait a minute. That let me know that disconnect. Because the person that thought this was a good idea is far away from the fire. They don't know. They just doing what they felt like is best. Same thing that I was learning in school. You had some kids that was growing up in Compton and Watts and all these areas that never even been to the beach. And I'm like, wait a minute. You never even been to the beach? And I just heard somebody talk about family dinners earlier. But it was no connection. The gang culture was the connection. Then when I went to Brentwood and I went to all these upper areas, whatever you want to call it, and I'm talking to the kids there, and they're disconnected emotionally from their mother because the mother is a trophy wife and this man just made a lot of money. So now it was no hugs on Christmas. It's just a yacht. It's no connection. And I started wait a minute. All this is connected even deeper than I thought. So when we start asking the questions like, wait a minute, what about women and equal pay? And I'm sitting in my head thinking, all right, I'm going to this school, this all-boys school where all these young men is bright. They're disconnected from emotions with women. They only got maids. They only got this. And then they got high education. They creating things like Twitter. They creating all these things. In their mind, how are they going to think that the woman is equal? They never got bred that way. They never even kind of even processed it that way. They never got hugs from their mother, but they extremely intelligent, extremely cerebral. They can make those decisions, but they're emotionally disconnected. They're destroyed emotionally. And then that's another process. I'm figuring all these things out. Still doing the one-on-one sessions now, still doing these group sessions, still speaking at all these places, and then volunteering my time. And in doing that, I end up selling my book to this school, and they end up buying 1,000 of them for $10 a piece. So now I got $10,000. I'm like, wait a minute, I can get out of this car now. But what am I going to do next? So I remember finding this apartment and then creating this company called A Wise Way. And A Wise Way was serving, how can I say, we interview professionals and use their testimonies to inspire children. Because as you go into these schools, you know one of those big questions we ask kids is, what is it that you want to do? They don't know. Sometimes they're just saying things to get us off their back. Like, I'm doing this, I want to be a pilot. They just going to throw out anything. And in doing that, I was like, wait a minute, we got to connect this because you might have 2 counselors or 1 counselor at a school and there's 700 kids. There's not possible to be able to help them determine what direction they want to go. Then throw in the missing parents, then throw in the gang culture, then throw in drugs, that's not possible. And then the homelessness, just throw in all that. It's not possible. So I created this workbook that coincided with A Wise Way. So we interviewed dentists and we interviewed actors and actresses. We interviewed all these different people about life and how did they get to their area so we can cut it down so kids can at least fill out this workbook and connect it to whatever it is that they want to do. If they want to be an astronaut, okay, cool. Then listen to what an astronaut truly does, not what this counselor has to tell you within 3 minutes. So once we started doing that, this company called Youth Mobile reached out and they wanted to partner with us to have this big STEM event. So we ended up flying out to Spain and they was entertaining us. They said, well, we want to have your interviews. We want to have your book. We want to have these different things. And I'm like, okay. So now it became this idea of how do we have all these STEM events? So we did a partnership with like NASA. We did it with Universal Studios. We did it with all the major companies to say, okay, how about kids go talk to who do it? Talk to the people at Universal. Talk to an astronaut. Talk to these people so you'll know exactly what the job entails. And what we served was this building was maybe about 10 times bigger than, we had 25,000 kids come to the event, put it like that. So during this, we served as the middle. We were directly in the middle where it was one kind of like this, maybe like 12 tables. And what I did is I brought on a whole bunch of mental health counselors and psychologists and whatnot, and I only played games. So we were playing Connect 4, we were playing Uno, we was doing puzzles, we were doing letting them watch the interviews on the iPad. That is everything that we were doing. And teachers couldn't rationalize why the students wanted to stay with us. Because they're sitting down playing Uno, the teachers thought they're just playing Uno. Let's go talk to NASA. Let's go talk to, because they got a whole immersive experience, but they don't know that we're asking them questions about life. So how are you feeling? How's school? How is this? Oh, you dealing with that? Oh, and we giving some advice based upon the things that they're saying. And I was like, wait a minute, this is a real thing. Because now it's starting to break that quote unquote stigma that we all know about getting help mentally and opening up about the things that's going on. They think they're just playing a game, which did what? It connected it to the Boys and Girls Club. From little Cyrus being 13, having the games, talking to the kids about what they're going through. Now, fast forward it, we're in the middle of 25,000 kids, NASA, and all these people around us, and the kids want to come to us and play Uno and Connect 4 and things like that. So I'm like, okay, I got something here. I'm starting to understand this. But at this same time, I'm growing myself. I'm starting to break down myself. And what I started understanding is the root of everything that I was feeling, that anger as a young boy. And what it came from was, like I said, I felt like my mother didn't love me. I felt like nobody loved me. So I had to understand, who is Cyrus? Who is Cyrus in relation to his mother? So I had the real conversations with my mother about, who are you? What made you get on drugs in the first place? What made you do crack? How did it happen? And then I found out what it was. I found out that my mother was actually with my father visiting my grandmother's house. And my mother went down to the basement to hang out with my aunt, and that's when they was doing this thing, freebasing. So they didn't know it was a new drug. So she started freebasing with my aunt, and that's how she ended up getting on drugs. And then as I dug in deeper, I realized that my mother had 5 sisters. She was the second, but she ended up seeing her older sister raped. And she didn't get raped because she was just not old enough. And the fact that she wasn't old enough, she ended up telling my grandma, and my grandma said, you shouldn't have been wearing that. It wouldn't have happened to you. So now my mother is growing up with this hatred of men because of what she's seen. She's growing up with this disconnect of men because of what she's seen. And as she grew, she didn't have no father around. But as she grew, she was just trying to find her direction. And she meets a man like my father. My father, as I did research on him, and I started talking to him, having those difficult questions, because my mission was to understand Cyrus. And I know these are the people that built me. So when I had a conversation with my dad, I'm like, how did you even get into drug selling? How did you, I'm asking all these questions. And he worked on this trash truck, and he found these gold coins, and that's how he got into the dope game. So I'm like, but who were you before that? Who was your dad? And he was like, my grandfather, or his dad, passed away his junior year of high school. And he said he had a great relationship with his father. And I'm like, so what happened? I start putting pieces together. I'm like, Dad, did you play football, basketball your senior year? Because we all played sports our whole life. He was like, oh, my senior year, I didn't get a chance to play. I'm like, why? Oh, I just didn't feel like playing. As I got older, I'm realizing, wait a minute. He was dealing with trauma. What man gonna play sports their whole life, be a standout star, and just not play? It was associated with the loss of his father or my grandfather. So I'm like, wait a minute. So I got a chance to now dig into my grandmother on my father's side. When they received the life insurance money, she coddled him with gifts. So it was a bunch of jewelry. It was a bunch of fur coats. It was a bunch of those type of things for him to deal with the loss of his dad. So who did he become? The guy that got gifts, the guy that gave out stuff, the guy that was emotionally disconnected because he never dealt with it. Now you put them two together, and here I am. This disconnect on both sides. And that's how I started shrinking that gap to understanding who Cyrus is. Why is his attitude so bad? Why is he disconnected? Why is he going all So as I started asking all them questions and finding out who my grandmother was, who my father was, who it was before them, as I'm breaking all this down, I started looking at saying, wait, how can I better myself all the way around the board? So it started becoming, what am I eating? What am I putting in my body? How am I talking to people? What's in my ear? What am I listening to? All these things I realized it made me who I am. Because if I'm listening to music and it's really saying, shoot 'em up, shoot 'em up, shoot 'em up, that's an affirmation in my ear on loop for 4 minutes. So what am I going to tell myself even when the music is not going on? Y'all hear it all the time with kids, where they'll just be walking, next thing you know, they'll just do a TikTok dance. Next thing you know, they'll just start singing some lyrics. Now, what is that related to? Mine was related to destruction. Mine was related to some lyrics that had no progression whatsoever. And that was in my ear, even subconsciously. I'm doing it without even realizing that I'm doing it. So I was like, wait a minute, I got to fix this. So I started looking into the smallest things, even drinking water, to eating. And then I even researched this guy, Wim Hof, on breathing. I'm like, wait a minute. So I didn't know how to eat, drink water, or breathe. I mean, like, this is the most basic thing, 3 things as a whole. So how am I going to think about how I'm going to help somebody with anxiety, depression, and all these other things that we do out here if somebody is not even hydrated? They're not even sleeping. They're not even eating. How do they not know if it's from mineral deficiency? And we think I don't have the answers if you don't even take care of yourself on a small level. Sometimes they're not even looking for answers, as we know. We've seen it all, as I'm assuming everybody here has worked with people. We've seen it all. But during this time, I started getting a chance to talk to the people that was high in their fields. So I got a chance to sit there and talk to a Denzel Washington. I got a chance to talk to a Jamie Foxx. I got a chance to talk to Dick Gregory. I got a chance to talk to all these people that was at the top of their fields, and I got a chance to learn their thought process, how they got to where they are, and what I can incorporate into myself. What we looking on time? I don't know, but what'd you say? Okay, I don't got too much time left, but I'm gonna keep going. So how they was doing, how they was using their time, how they were being who they were. And in doing that, I figured out what I can incorporate into me and what I can build. So I was like, now what can I build that can bring everybody together? Like that Boys and Girls Club, like those centers. And what I realized is now I was like, you know what, I'm gonna create a community center. But then the base of community centers ask for money too much. It's like now I gotta go fundraise, and you lose sight of what it is that we actually gotta do. And it's not on purpose, it's just you gotta raise the money to keep the lights on in the building. So I was like, I'm not gonna do that. What else am I gonna do? So I got this idea of creating a mental health cafe. So that was my way of pulling in everything. So now I can have all the books that I've written, all the programs that I've ever done, all the people I've ever met, mixed with the food that I learned how to eat, the water I learned how to drink, all those things, and put it into one environment. So as the woman, her name is Alex, she's out in Los Angeles. I meet with her and she tells me about the opportunity to have a cafe in Massillon. So I end up coming back and setting up this mental health cafe. But the funny thing is, it got shot down initially. I put together this proposal and everything. They was like, we don't want to have no mental health cafe. We don't know what that would do. What if somebody does this? What if when people don't know, it's like they thought somebody with a mental disability was just going to come in and just destroy everything. It's like they didn't even process what they were actually saying. So I'm like, I'm going to have it or else I'm just not going to open. So we end up opening, and the line was all the way down the block. I mean, it was far down the block because people understood that I need someone to talk to. But also it was breaking that stigma because now when you come into Greatness Cafe, you don't know if somebody is coming to get a sandwich, a smoothie, or actually sit down and have a conversation. And it's not actually considered a session. It's a conversation. But it's with a professional, it's somebody that knows. So when we sitting there having this smoothie, I say, how's your day going? That's what we ask when you first walk in. How are you feeling? We don't ask what you want to eat or drink. How are you feeling? What are you up to today? How's your day going? Those are the conversations around a smoothie, around a sandwich. And then from there, we implemented the programming where we had women empowerment. Then it was teaching chess. Then it was still the one-on-one set. All these things started coming out of the cafe. And I'm starting to see it build up. But with that came in stories. It was a young girl, like our menu. I don't know how many people here have been to the Greatness Cafe, but I know a few of them. I recognize faces. But if you get a chance, Massillon, Lincoln Way, 121, throw that in there. But as you come to the cafe, the whole menu is in affirmations. You got to order. It's called I am great. It's called I am smart. It's called I am strong. That's how you have to order your sandwich. And if you don't use the affirmation, you don't get it. We will have a standoff. And trust me, I done had a few standoffs. So one in particular, this one guy came in and he walks up and he was like, I want the cherry mango smoothie. I was like, I don't recognize what that is. He was like, I want the cherry mango smoothie. Kind of like emphasizing, get my stuff. You know what I ordered. And I'm like, no, you got to call it by its name. It's called I am great. So he going to say it low like, I am great. Like, all right, hurry up, make my stuff. And if anybody know me, I'm like, what did you say? Say it a little louder. So now he said it loud, but he was being dramatic. Like, I am great, there you go. What was funny is he was just saying it to be funny, to be dramatic. But the people standing in line behind him thought he was just happy to say it. So they end up paying for his food. Like, I love that. I am great. Yeah, you know what? Let me say the affirmation like he did. So they end up paying for his food. And I remember him going to the side, and he sat down with his sandwich and smoothie at this time. And he probably said, I can tell by where somebody is sitting in the cafe what may or may not be going through in their mind when they put their back towards everybody and they just looking out the window. I was like, they got a lot on their mind. So he sits there for 40 minutes or 50 minutes or so. He comes back and he's just crying. You know, older man, he's about 60-ish. He's just crying. And then he's like, I want to thank you. I'm like, for what? He's like, for making me say the affirmation. I don't even remember the last time I talked positive to myself. I don't remember the last time I talked positive to myself. And I said, man, that's pretty deep that you don't even remember. So now what's funny about him now, he still comes into the cafe often, and he'll sit in this chair, and then somebody will walk up, and they'll be like, you know, I want to get the cherry mango. You'll hear him from the side. It's called I Am Great. I'm like, this guy, now he knows all the affirmations. So we also had a young girl come in. We have this local dance company that's close to us. And we had a young girl come in, and she's looking up at the menu. She had to be about 8. She's looking up at the menu, and she's like, so what do I do if what I want to order is not true? I was like, what do you mean? She was like, I really want the I am smart, but I'm not smart. I was like, what made what make you think that? So now I'm sitting here having a conversation with the young girl, and I'm like, well, we're going to say all the affirmations now. You say all the affirmations, you get a free smoothie. So now she went through them all, and what did we do? If you know me, we took it from the top again. There wasn't nobody behind us, so we're going to go through it all again. And as we went through it, I noticed her confidence. And as now when she come in with other students at the dance company, she makes them say the affirmations. Like, you got to say, I am smart, I am strong, I am, or else you're not going to get it. Look, I'll say it with you. And I seen her do it. Like, I'll say it with you. Now she's saying it with other young girls. I was like, this is powerful. This is becoming bigger than what I even imagined when you got some people that never even talk positive to themselves. So now the third story was this guy that came in, and he was actually lost. He was just pulling over so he can charge his phone and use the bathroom. So his phone was dead, and he said he was on his way to Indiana. So he gets in, he goes down, use the bathroom, asks me if I can charge his phone. So we charge it, and I'm sitting there having a conversation with him. He like, what is this place? I'm like, it's a mental health cafe. I'm giving him the whole rundown. And he's like, you mind if I talk to you? I'm like, it's open. So we sit down and we have a conversation. This guy was telling me about going through a bad divorce and how bad it was for him because his wife had taken everything and all these different type of things. Long story short, he was on his way to take himself out. And this was the pause. So during this whole conversation, we talking for 2 hours-ish about life, about value, about all these things. And then now he asked me on his way out, he like, you mind if I pray with you? Like, I don't mind at all. So we're outside standing, 2 grown men standing next to the Lincoln Way holding hands. And he's just praying, letting it all out. And I mean, he's just going, and I'm sitting there listening. I'm bowing my head. I'm being respectful, everything. And then this man hugged me tight, like, you know what, thank you. I appreciate it. And I'm like, this has nothing to do with Cyrus. This is that young boy that was in the living room. This is that young boy that was out there in Los Angeles. It's that young boy that's just trying his best to make things better, trying his best to build without destroying. That's all I was trying to do. But on this mission, as we all are working with people, we all are working with kids, we all are working, we have a whole lot to deal with. But I don't ever want any of us to feel like what we're doing is not effective. Because that happens to all of us in this field where we felt like we should have gave them better advice. I could have said that differently. Because we go through rhythms too. We go through tempers. We have everything in us that we're helping other people with. The attitudes and some of those other things that we have never overcame. So I just want everybody to understand that we're trying our best to make it better than it was yesterday. And I don't want us to put that added stress on us in this field, that we have to be perfect, that we have to give these people this and we got to do this. You got to keep yourself in the same time. It is very, very easy to lose yourself in this field. Extremely. Because we go home with it. We wake up with it. We talk to our boyfriend, girlfriend, husband, wives, and all those people with it, our cousins. But it's a few places we start. I say this everywhere I go because we think, what is the best way to help the community? What is our best way to help? I say start with the people that's right beside you. We think about going to all these places. I want to go out to wherever to help that. But don't forget about your little nephew or your little niece that's growing up at the house where you know how your sister is raising them. You know that when they come to your house, that's when they feel something. They feel peace. They feel love. Don't skip picking them up because we got to go to Cleveland to help somebody else. I'm not saying don't do that at all. I'm saying don't forget about the people closest to you too, because that's what happens, because it's the most difficult. It's the most difficult to help your sister, your brother, your friend close, your next door neighbor. It's so difficult that we will say, forget it. Let me go help somebody else that's going to listen, but that's always the test. No matter what you ask for, you will always be tested equivalent to it. You can't have $1 million problem without $1 million. You can't have, so when you guys are out here asking for great things, I want to help people do this. I want to help people climb over this mountain. I want to help with anxiety. I want to help with depression. I want to help with suicide. I want to help with all these things. Understand you're going to be tested against whatever you're asking to do. And that is the test. That's the hardest part, is understanding what we're actually signing up for. I want to end on this. I don't know what time it is. I know I probably ran over, so I apologize. How much time is it? I got time? Oh, I'm cool? I'm good? Okay, I'm good. 3 minutes, okay. I want to end on this. I came up with this poem that goes along with this speech. To go along with this speech to say how music ties in and the stories that tie in. And it goes like this. It's like, my mom never knew her dad, and my dad barely knew his dad. My older brother just found his dad, but I really got to know my dad. I see the differences that we have. It's like looking at the world from different perspectives. Life lessons kept us stressing. Who would have thought one womb with different sperm would create some blessings? Different path, but the same objective. Trying to plan ahead for a better life while living in the present. Ignoring every aspect of guessing. At least I try. I jumped off the ledge to see if I can fly, because I learned that this thing we call life is bigger than I. My name is Cyrus Assar. Thank you. I appreciate everybody. I don't know if it's questions or anything like that, but thank you. Am I answering any questions, or is there any questions? Okay, no questions. When I'm in schools, I get way more. I'm with professionals, I get no questions. But once again, if anybody want to ever come down to the cafe, you can follow me on Instagram. It's Cyrus Assar. The cafe is called Greatness Cafe. I wish I had more time. I could have told you I got a mental health and wellness center as well. Zero gravity massage chairs, things like that, because we know people don't want to be touched by those they don't know. Working on body butters and just trying to figure out a way to make an approach from top to bottom. Make sure whatever we putting on our body is healthy, whatever we putting in our body is healthy, the way we think, the environment. So, yeah, Greatness Cafe and Cyrus Assar on Instagram. And once again, anybody ever want to talk to me, come down to the cafe. It's a few of you that I have talked to. I see it in the audience. And y'all know who I am. But the rest of you that don't know, come down there and meet me. Thank you.
Thank you. That was awesome. I was. The stage. All right. So that is a wrap. But before we wrap up, what do you, as participants, another shout out to our great speakers. Thank you, Cyrus. That was really insightful, empowering end of our day. I think maybe another round of applause for Cyrus, but everyone who was before him as well. Feeling very grateful for all the variety of speakers and all their different lenses, but also feeling very grateful for everyone coming together today. So thank you from Walsh community. Thank you from Dr. Michelle Tilstra and I. I know some of you worked with Rose Mogus in organizing this, and of course Walsh University for this great facility. So there's so many people to thank, but it was a great day coming together. There's a couple of housekeeping tips as always. You were passed out these QR codes. This is where you can please scan in there and give us some evaluations of today's symposium. We would love to hear your feedback. Make sure you signed in if you're looking for CEUs or anything for your licensure. And again, see, so why did I get up here? She's the brains behind the operation. No, but yeah, so please, CEUs and evaluation. And any other closing remarks? Thank you. Have a great weekend. Get some rest, self-care. All right. Thank you, everyone.